Hi, Jeremy.
Hi.
Today we're going to be doing a cranial nerve exam on you. Just going to be taking a look at some of the functionality in the head, the neck, some of the neurological functionality, and making sure everything's okay today. Does that sound fine?
Sounds great.
Perfect. Can you confirm your name and date of birth for me?
Jeremy 1-1.
Okay, and that is what I have here, so we'll go ahead and proceed with the examination. To start out, I'm going to ask you a couple of questions. I just want to get a sense of neurologically how everything's functioning, how your memory's working. So can you tell me what you had for lunch today?
A sandwich.
Sandwich, okay. And can you tell me the town that you were born in?
I actually can't remember.
Can't remember. Okay, no problem. Just make a note of that. And tell me a little bit about how the weather is today outside.
It's okay.
Is it sunny? Is it raining?
It's like partly cloudy.
Partly cloudy. Okay, and what about the temperature?
It's in the mid-60s.
Okay. Can you tell me about what time of day it is right now?
It's in the evening.
Okay. And if I were to say, ask you for the time, where would you look? Like if I said, what time is it? Where would you look to tell me that?
On my phone.
Okay. And what if you were wearing a watch? How would you look at that? Like that. Okay. And hold that up again. Can you point where on your wrist the 12 mark would be? On the 12 number on the watch itself?
Probably here.
Okay. And what about the 3?
I'm not sure.
Okay. No problem. It's just a couple of those neurological deficits. I'm going to give you a couple of words to remember, and I just want you to repeat after me right now, and then I'll ask you again in a couple of minutes, okay? So, dog, pillow, and plant. Those are all things in this room, so I want you to point at them and repeat what I just said.
Dog, pillow, and plant.
Okay, wonderful. In the meantime, I'm going to have you just draw a couple of things on my tablet here. Just get a fresh page here. So I'll give that to you. I want to see how you just write your first name, please. Okay, and can you draw something that has more than 3 sides, a shape that has more than 3 sides? Okay, anything that has more than that?
I'm not sure.
Can't think of anything? Okay, no problem. So again, just a few mild deficits there. If I were to say it's raining cats and dogs, what does that phrase mean to you?
That means that it's raining a lot outside.
Okay, very good. And if you saw a little child crying in the street, what would you do?
Probably help them.
Okay, and what would you do to help them?
I would try to find their parents or get them out of the street.
Good. So logic and reasoning is intact. So just a little bit of that memory and pulling direct facts and information. What were those 3 words I told you?
Dog, pillow, and plant.
Okay, so short-term memory also looks okay. That long-term memory you weren't able to do as effectively. Right. So I'm going to set this down, sanitize my hands, and we'll begin with the physical assessment. So Jeremy, the first thing I want to do is just take an overall look. I want to make sure there's no obvious bruises or injuries. Have you fallen and hit your head or hurt yourself in any way in the last few days, few weeks?
No.
Okay. Any changes in personality, in mood, in sleeping?
Not really, no.
Okay, wonderful. So I'll just take a look with my light here. Again, just looking for anything obvious that may affect the cranial nerves. Just turn your head gently for me, please. I'm just going to look at the other side. Also looking just for any other signs of something not being right, any changes in the hair, discoloration. Feel for some temperature as well. That all seems normal. Any pain when I press around here?
No.
Anything here?
No.
So we'll start out with the eyes. So taking a look at them, look straight ahead for me, please. Just right on that back wall, back there. Very good. I'm going to pull them down. Okay, a little bit of redness. Can you look down for me and look up? And side to side, nice and big, side to side. I'm going to test the reflexes in the eyes. So go ahead and close for 3 seconds. Just let them tear again. Let the eyes recover. And when you're ready, open them up and you're going to see a bright light, all right? Reactions are not quite as brisk as we'd expect. Was there some pain or discomfort with that as well?
Maybe a little, yeah.
Okay. I'm going to just shine it right here. So again, just look away from the light. Okay. There's equal reflection in each eye. Do you feel like you can stare at the tip of this pen without discomfort? No double vision here?
No.
Okay. Follow it everywhere it goes. Just don't move your head. Any double vision?
No.
Okay. Can you again look straight out that way? Ignore my pen. Look at the pen and follow it out and follow it in. All right, relax. So there is a little bit of mild nystagmus. And that just means the movements of the eyes are a little bit jumpy. Any dizziness recently?
Not really, no.
Okay. I'll have you read something for me. Do you normally wear glasses?
I'm not to read.
Not to read, okay. So I'm going to point out a couple of words here, and I just want you to read them. What word is that?
Before.
Okay, and that word?
Complete.
And what about this word?
Ironically.
Okay, so your nearsighted vision is perfectly fine there. I'll test your far-sighted vision in just a moment. But I just want to look into the back of your eyes now. And again, this will be a bright light, so it'll be a little uncomfortable. I'll make it as quick as I can. Again, just look ahead. I'm going to come in from the side. And that reflex is intact. I'm going to do the same thing on this side. So no issues with the functionality of the back of the eyes. I'm going to test you for some color blindness. So I've got this little book here, and I just want you to tell me, if anything, what do you see?
I see a 7.
Okay. And what about this one?
I don't see anything.
That's excellent. You shouldn't. I want you to, with your finger here, just trace the line from this X to this X using your finger. Very good. So I want to test your vision a little farther away now. So I'm going to go about, I'd say about 5 feet. Does it seem about 5 feet to you?
Mm-hmm.
Okay. Can you read this line right here?
D, H, J, B, S.
Okay, cover one eye and read it backwards for me.
S, B, J, H, S.
Okay, and cover the other eye and read it forwards for me.
G, H, J, B, S.
Okay, so again, a couple misses there, but you did mention you wear corrective lenses. Is that for distance?
Yeah, it is.
Okay, so that makes sense. Go ahead and cover one of your eyes with this card. I'm going to stand right about here. So can you see my nose?
Yeah.
Okay. I want you to keep staring at my nose, but tell me when you see my fingers wiggling, okay?
I see him wiggling.
Keep looking at my nose.
I see him wiggling.
Okay.
Wiggling. See him wiggling.
Okay, switch eyes for me, please.
I see him wiggling.
Keep looking right here, okay?
I see him. I see him.
Okay. So a little bit of delay on the field of vision for the peripheral. So I'm going to move on now, past your eyes into the nose area. So I'm going to be checking your smelling, but first let's just take a look at the nose itself. Just sanitizing my equipment. Okay, so just tilt your head back for me, Jeremy. Take a look inside. Do you see a little bit of redness and swelling? That side looks okay. Tilt your head down. Can you breathe in for me? Definitely more patency on that one side. I'm going to give you a few things to smell. First, can you just put your wrist out for me? I'm just going to be rolling them on your skin and have you smell them. So I'm going to generously apply this. I want you to hold that up to your nose and tell me what you smell.
I think cinnamon.
Okay. It's supposed to be something floral. That's lavender, I think. So that's not quite what we would expect as a finding. Let's try another one. Let me sanitize the other side. Try this one now. And these are very, very potent smells, so you should be able to smell quite a bit of it.
Chocolate?
Okay. That was supposed to be coffee. So that is a bit unusual, and I do want to just note that in your chart because that finding is, again, not as expected. No other pain in the nose, though?
No.
Okay. Take a look in the ears now. Start out on this side, so just turn your head for me, please. A little bit of wax buildup, but no redness, nothing unusual. Same thing on that side. Nothing out of the ordinary. No unusual colors or swelling that I wouldn't expect. So I'm going to test your hearing. I'm going to first just whisper something covering up one ear. So I'll cover up this side and I'll whisper in this ear and I want you to repeat after me, okay? 2, 6, 9.
2, 6, 9.
Yep, that's very good. And on this side, G, L, F.
PLF.
Okay, very, very close, but there was a little bit of hearing disturbance there. So let's do some further testing. So to start out, just got a little bit of wrap here in the office. Just makes a little bit of a noise like that, okay? Close your eyes and just tell me which side you hear it on.
The left side. The right side.
Okay.
The right side again. And that's the right side. Left side.
Okay.
Left side. Left side.
Okay. So definitely some issues with the hearing, which side you're hearing it on. I'm going to hit this tuning fork. I want you to tell me which side you hear it on, left, right, or both, equally.
Left.
Okay, I'm going to try it one more time. Again, left, right, or both?
Both.
Okay. So it seems like that was, again, a little bit of a mixed result test. I'm just going to do one more thing. I'm going to make just a little tapping sound. I just want you to tell me left, right, or both, okay?
Okay. Right. Both.
Okay.
Left. Left. Both.
Okay. Again, some inconsistencies there. I think that would warrant a truly in-depth hearing test. Let's take a look into the mouth now. You could just open up and say ah for me. Okay, good. Functionality there is good. Just stick out your tongue for me. Okay, and lift it up onto the roof of your mouth. Yep, exactly. And side to side. And the other side, very good. Okay, can you stick it out and do that? Stick it out, move it side, side. Okay, and you can put it back in your mouth, symmetrical there, that's very good. Can you push it into my hand here? Okay, strength's a little bit weaker than I would expect. Same thing on that side. Can you push down against, with your jaw, like that? Okay, that's nice and strong though. Can you clench your teeth? And here, and open and close. A little bit of clicking there. Is that normal for you?
So.
Okay. So far, the strength in the mouth is generally okay. A little bit less in the tongue than I'd expect, but not beyond the normal scales. Can you push down against my hand as hard as you can? Okay, and back. Okay, to the right here. And the other side. And down to the shoulder. And this side. Alright, that's all 5 out of 5. So you did really well there. Can you shrug your shoulders for me as hard as you can? As hard as you can. Okay, and relax, and arms up, and push me away. Push me, and pull me towards you. Okay, yeah, a little bit less strength than I'd expect there as well. I'd say about a 3 to 4 out of 5. So I just want to move the muscles because of that. Just check the tone in the muscles and just relax completely for me. Okay, on the side. And that feels fine. No real rigidity. And take some measurements now. I'm just going to get from here. I'm just looking that these are all within the normal cephalic range. And so far that they are. Check a little bit more for symmetry. Can you open your eyes as high as you can? Don't let me push them down. Okay. And can you close them really, really tight? Very good. Can you smile for me? And frown. Okay. And just puff your cheeks out and hold them there. Okay. Just a little, again, a little bit of less strength in the face than I'd expect. And that's probably that same nerve, that facial nerve, to do with the tongue. Let's test some of your sensation. So, again, just have this little bit of paper here. I just want you to say yes when you feel it, okay?
Yes. 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 Yes.
Feel that?
No.
Like a little harder.
Yeah, I felt that one.
Okay, let's check a couple other spaces right here.
Yeah. Yes.
Okay.
Yes. Yes.
Okay. So a little bit of sensation loss in that right cheek. Let's continue to test that. So I'm going to have a little bit of a pokey tool. So if you give me your hand, sort of sharp like that.
Mm-hmm.
And I'm just going to grab a tissue from over here for the soft. So there's going to be a difference of this versus that.
Mm-hmm.
And I want you to tell me sharp or dull, and I want to make sure you can differentiate between the two, okay?
Okay. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp.
Okay.
Sharp. Dull. 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 Sharp. Dull. Dull.
Okay, so again, a little bit of isolation there in that right cheek. Have you had any tingling or numbness in that side of your face?
Not that I've noticed.
Okay. I'm thinking it probably is more of a surface issue just because you had full symmetry, strength, and use of the face. A little bit of weakness in that jawline, but or the tongue and the cheeks, but I'm surprised it's up here. That to me, just because it's such a small area.
Mm-hmm.
Okay. Let me see. Does this feel cold here?
Yeah, it does.
Does it feel as cold here or colder here?
Maybe colder.
Colder than here.
Mm-hmm. Oh, yeah.
Okay. What about here? Does this feel the same as that?
Mm-hmm.
Okay. And this as this?
Mm-hmm.
Do you feel this buzzing there?
No.
Okay. What about here? Do you feel that buzzing?
Mm-hmm.
And do you feel it buzzing here?
Mm-hmm.
And here?
Yeah.
Okay, so it's again just that small area. Any burns, scrapes, anything like that there recently, even if it's healed now?
No.
Just a couple more little things left for you, Jeremy. We're almost done. I want you to close your eyes. I'll start out by just putting something into your hand here, and you can just feel around and try and tell me what that is.
I'm not entirely sure.
Okay. I'll try something a little bit more typical. So, again, with that hand, tell me what that is.
It seems like a pen.
Yep. And the other hand, I'm going to give you something. What does that feel like?
That's the same thing.
Okay. And which is a
pen.
Okay. So that is good. The first thing I gave you was sunglasses. They can be a little bit more tricky for the fine motor skills, but since you were able to feel that pen, again, not too worried. I'll just have your finger now, please. And I'm going to, the other one, please. I'm going to move it up like this or down like that. Just tell me if you feel up or down.
Up, down.
Good. And the other side, I'm just going to do it with this one now.
Down, up.
Very good. Just with this hand, just you feel the difference between that 1 point and 2 points.
Mm-hmm.
Tell me what you feel.
1, 2, 1.
Okay, what number am I drawing in your hand?
3.
Okay, and what about now?
1.
And add those together, what number do you get?
4.
Let's see the other side.
2, 1.
Okay, and what is this letter?
L.
Okay. So again, that sensation loss on that right side of your face is a little concerning. However, it does not seem to be neurologically affecting the rest of your body. Can you do this for me? Just really slow. Okay. And what about on your back and forth? And lift your arms up, put them out nice and straight. Can you close your eyes and flip them over? Okay, relax. Yep, well that's fine. That's great news. Just your reflexes and then you're all set today, Jeremy. So I just want you to relax for me in my arm. Not too reactive there. That's better. Okay. And coming around to this side. And again, relax fully for me. Same level of reactivity, which is actually good if there's low reactivity, but it's bilateral. Okay, keep looking straight ahead. And this side. Okay. So, there were a few things, Jeremy, that you did miss on the exam, and I am a little bit concerned about that I think warrant further testing. My suggestion is we do a real in-depth exam, maybe in about 3 weeks, to see if there's any changes, if anything worsens, because it could simply be that, you slept on that funny, and it's a little tingly today, and you're not feeling 100%, but there were enough issues we had in all parts, especially with the hearing as well, that I think it warrants further testing, okay?
Okay.
Any questions for me today?
No, I don't think so.
All right. Well, I hope you feel better soon, and thank you so much for your time.
Thank you.
Today we're going to be demonstrating a diabetic foot exam. For the purposes of this assessment, you're going to be presenting some neuropathy in the bottom of your left foot.
Okay.
Okay, so that will help us demonstrate the exam to others, and as well as run through the entire exam that we would do for a diabetic patient.
Okay.
If you have any questions, please let me know. And are you currently in any pain right now? Anything I should be aware of during the assessment?
No.
All right. So before we begin, I want you to confirm your first name and date of birth for me.
Jeremy 1-1.
Okay, and that is what I have here on the chart, so I'm speaking to the right patient. And can you just confirm that you are a diabetic?
Yes.
Thank you. So I want you to do a little bit of walking for me. Do you feel steady on your feet?
Mm-hmm.
Okay, so I want you to rise up on your feet for me. Okay, and if you could just step around here and stand comfortably. Is that okay for you?
Mm-hmm.
All right, I'm going to be checking the feet, and I'm just looking for symmetry, position, any listing to one side or the other, the ability to stay upright, and everything looks fine. Jeremy, would you please just walk for me in a straight line that way? Just walk forward. I'm going to watch the gait, then turn around and come backwards. Okay. And I want you to do the same thing, but just walk one foot in front of the other like that. Just looking for balance and strengthen the feet. When you come back, could you do so walking on your toes? Any pain with that?
No.
Okay, and could you stand on your heels for me? Just sort of lean back on your heels and take a few steps backwards, forwards, whatever's comfortable. Okay, very good. So strength is there. I'll have you just sit here right where you were before. I'm going to take some of your vitals. All right. So I just want to take a look at you first. I'm looking for any obvious signs of distress on the body. We're going to mostly focus the exam on the feet, but making sure there's no other health issues. And let me take a look. Open your mouth for me and say ah. Okay, I'm looking at the tongue and the lips. I'm going to put on some gloves here. I'm just going to be feeling the inside of the mouth. Just open slightly for me. I'm just going to really gently feel. Could you stick your tongue out for me, please? And up and down. Okay. Just have you stick your tongue out again. I'm just going to grab it. I'm just going to feel it. Okay. I know that can be a little uncomfortable, but important to check. So that's all fine. Any changes in your diet or your sugar intakes recently?
Not really, no.
Okay. I'm just going to take a listen to the heart. Fine. Feeling some pulses up here. And just that way I can compare them down to the feet. Okay. And take a quick temperature and then I'll have you lay down. Temperature is normal. So, Jeremy, go ahead and scoot back for me. I'm going to take a look at your feet now, all right?
Okay.
I've got some shoes here that you brought in today. Is that correct?
Mm-hmm.
Just going to look at the wear inside of them. Bottom of the foot as well. Looking for anything that would indicate an irregular walking pattern, more wear on one part of the foot than the other. Same thing with this one. Paying particular attention to the left shoe since that's the foot the patient is complaining of some sensation loss. Next, taking an introductory look at the feet themselves. I will remove the socks in just a moment, but looking for any wear in the bottom of the sock. There's no obvious difference in the feet. Looking at how they lay. Before I remove the sock, I'm just going to touch your feet and your legs here. And I want you to tell me if there's any pain.
No.
Okay. Okay, well, let's start with the unaffected foot, which would be the right side, correct?
Mm-hmm.
So I'll remove this sock here. And we'll get a baseline for everything. Looking for any discoloration, any lesions or injuries, open wounds on the feet. It can be a little harder to heal when you're experiencing complications from diabetes, and you may not always feel pain or infection on the feet. So it's really important to check. Relax for me. Let's do some initial strength on this foot. So I want you to pull back on my hand as much as you can. Very good. And push forward. Okay. I'm going to hold the ankle here. I just want you to push to this side of my hand. All right. And the other way. Okay. No problems there. I'm going to bend this knee for me. And I just want you to push out this leg towards me. Good. And pull that heel back. All right. Relax. And just this big toe, push that down. All right. Good strength there. I'm going to feel for temperature now. I'm looking for a consistently warm temperature. A little cooler on the bottom of the foot, but that's normal. I'm going to feel the pulses. So Jeremy, I'm going to start doing a little bit of sensory now. So the neuropathy is presenting in the left foot. Have you felt any tingling or numbness in this foot?
Not too much, no.
Okay. Any pain in the nerves when I press here?
No.
What about right here on that plantar fascia?
Maybe it's a little sore.
Okay. And anything in the heel?
No, that feels okay.
Okay, just eliminating any other causes for pain or discomfort in the foot. So it seems like there might be a little bit of tightening of that plantar fascia, but other than that, no burn spurs, no Morton's neuroma, anything like that. So I've got just a really soft little wisp. I'm going to show you right on the top of the leg here. You feel that? I'm going to work my way from the top of the leg all the way down to the top of the foot, then the bottom of the foot. And I just want you to say yes when you feel it, letting me know that the sensation is there.
Okay. Yes. 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 Yes.
Okay, good. So sensation was fully intact there. I went down the entire leg. And was there any change in sensation? Does this feel the same as that?
Yeah.
And this and that?
Mm-hmm.
Say same?
Yeah.
Same?
Basically.
Yeah, okay. Obviously there are some parts of the foot that can be a little more callous than others, but we'll investigate a little bit further. The other side of my tool here is just a little bit rougher. Feel that? So I'm just going to run it down the front of the leg here. And I want you to tell me if there's any change. You feel that scraping there? Let me know if it feels differently at all as I bring it down the leg. Any change there?
No.
Okay. Does it feel just as scratchy here
Yes.
as it does here?
Yes.
Okay. And can you feel it across the top? Feel it on every toe? So far you're presenting normal findings in this foot, but for the purposes of the assessment, I'll go ahead and test a few more things. I'm going to hit this vibratory tuning fork, and it's going to feel like a little buzz. I'll show you right on your knee. Do you feel that buzzing? Is it still buzzing there?
Yeah. Yeah. No.
Just pressure, right? Okay, good. How about there?
Buzzing. Buzzing. Pressure.
Okay. I've got a cold vial here. Does that feel cold? Okay. And just say if it feels cold or warm.
Cold. Warm. Cold.
Good.
Warm. Cold.
Good. And what about there?
Cold.
So what we would do if you were having any sort of sensation loss is we continue with sharper tools down the leg. So again, tell me if you feel this. And does it feel pointed or soft?
Pointed.
Yep, pointed here. Same thing? Same pressure,
Yes.
same feeling?
Yes.
Is that sensation the same? Here? Here?
Yes.
Here? And here?
Yes.
And the last tool we'll use is to just check for, again, that loss in any sharp sensory, but of course you on this foot are not presenting that. So this should feel the same all the way down, okay? Tell me if it doesn't. Completely the same? And on the bottom of the foot here, is that completely the same?
Yes.
Okay. So we found that the foot here is completely normal. I'm going to just look very closely with a magnifier at the bottom of the foot for anything. There are just a few bits of dryness here, which is very normal for any feet, but I want to just examine them a little closer before I move on. And I'm not seeing any signs of infection, inflammation, nothing concerning. Alright, so I will go ahead and put your sock back on so you can keep warm. Moving on to the other side. Again, just starting with it looking. I'm going to remove the sock. Feeling for that temperature again. And this foot is cooler than the other side. That could be an indication of some circulation problems. So we'll go ahead and take the pulses. It's a little bit weaker on the side. I would say 1+ versus 2+. So that also is aligned with some of that neuropathy he might be feeling. I'm going to do the strength test on this side. I want you to press down for me and pull back. Okay, holding the ankle, come this way, push this way. Yeah, there we go. And this side. Okay, and bending the knee up like that, push me away and pull me towards you. Okay, and relax the leg, just this big toe down. All right, and some weakness on this side as well. I'd say 4 out of 5 for strength. I'm going to start with that really light sensory touch, and I just want you to tell me yes when you feel it.
Okay. Yes. 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 Yes.
Feel that?
Yes.
Okay, what about this?
No.
No? Feel this?
No.
Okay. So again, consistent with those symptoms that he was describing. So I'm going to do the same thing with a little bit of a sharp point. I want you to tell me when does it start to get more dull? Or when do you just feel, you feel that sharpness there?
Mm-hmm.
When does that start to change as I move down the leg? So normal all the way up on the front.
Mm-hmm.
What about this side? Same up there?
No.
Okay. When does it stop feeling?
Around there.
Around right here.
Mm-hmm.
So this feels different than this.
Mm-hmm.
Okay. And what about this versus this?
Mm-hmm.
So which one is sharper?
The second.
So this one here versus this one here, which one is sharper?
The first.
And that versus that.
Second.
So we'll need to do some more investigation in that. So I've got that vibration again, and I want you to tell me if it feels like vibration or just like pressure. So what does that feel like to you?
Vibration.
And what about that?
Vibration. Pressure.
Pressure, okay.
Pressure.
Good.
Vibration.
All right.
Pressure. Pressure. Vibration.
Good. All right. So again, able to feel the pressure on the bottom of the foot, but not able to differentiate that vibration there. Again, got a little bit of a cold vial here. You feel that coldness? Okay, does it feel cold here?
Yes.
And here?
Yes.
Does it feel as cold here?
No.
No. So this feels colder than that.
Yes.
Okay. Which is colder, 1 or 2?
1. 2.
Okay. Tell me when that sensation of coolness starts to fade.
There.
Okay, so it's right at the bottom of the foot here. Any pain or tingling when I press this hard?
No.
It just doesn't feel like as much as it does on this side. Okay. So I have that very sharp tool again. I just want you to confirm that it feels sharp all the way down the front of the leg.
Yes.
Okay. I'm going to do it on the bottom, and I just want you to tell me when it starts to feel less sharp.
No.
Okay.
No.
This side.
No.
Okay. And it feels the same sort of dullness all the way up.
Yes.
And the toes as well. Same sort of feeling. So we can note that the sensation in the bottom left foot from essentially the arch of the foot on that side and then the distal side of the foot are affected. And the start of the heel as well, as that you can feel that back there,
Yes.
but feels a little less right here. Okay. Right, so I'll just take that closer look here. There's less signs of this dryness on this side, but still a little bit. So I just want to check to see if there's any other problems there. But it looks pretty surface. There are no signs of open wounds or anything that needs immediate treatment. But you do need to be more careful of that because the sensation is lower. You're not necessarily going to feel when a piece of that dry skin cracks through and starts to bleed. So you need to be checking your feet and coming in more often. So I'll go ahead and put the sock back on for you. Just do your reflexes and then you'll be all set. So you're just going to feel me hit you a little bit here with the reflex hammer. Just relax completely. Okay. Same thing on that side. Slowly relax. Okay, reflexes are intact. Scraping the bottom here. Good. And definitely a little bit more reaction on that Babinski on that unaffected side. And so I'll just do the legs here as well. So Jeremy, I want to thank you for today's demonstration. You did a great job in displaying those symptoms. Do you have any other questions for me before we finish the assessment?
No, I don't think so.
All right, well, we certainly appreciate your time. We would recommend that you follow up with a podiatrist to be put on a plan of action to maintain the integrity of the feet. And we'd also be checking your sugar levels, making sure your diabetes is under control, okay? Hi, Matt. I'm Dr. B. Nice to meet you today.
Nice to meet you too.
So I see here that you're coming in for a new patient assessment. Is that correct?
Yes.
Perfect. So what we usually do for the first time we see someone is just go head to toe, checking every system, getting a baseline for your file, and then that way if anything changes when you come back in the future, we can refer to that. Does that sound okay?
Yes.
All right. So can you just confirm your first name for me, please?
MAD, M-A-D.
Okay. And no pain at the moment? You're not having any pain or
I'm not
problems at the
having
moment?
any pain.
Okay, so on a scale from 1 to 10, 1 being no pain, 10 being excruciating pain, where would you rank yourself?
1.
Okay, perfect. And so I'm just gonna, same thing, just go head to toe with a few questions. I'll take a seat here and get a bit of a health history. Are you currently on any medications, taking any medications?
No medication.
Okay. And what about your sleep? What is your sleep like?
I go to sleep around 9.
Okay.
Wake up at 6.
Wake up at 6. And does that feel like enough for you?
Yes.
Okay. No, so no tiredness, fatigue, fogginess, anything like that?
No, just regular.
Day-to-day life? Yes, exactly. What about memory? Any issues with memory or cognitive thinking?
I haven't noticed anything abnormal.
Okay, good. Moving down to the eyes, do you wear any contacts or corrective lenses?
No.
Okay, so that's wonderful. So we'll go ahead and check that, but otherwise no issues with bright lights or
No.
floating things in the eyes? Okay. Any changes to your smell or difficulty breathing in and out of the nostrils?
No.
And any allergies, dripping of the nose, anything like
I'm
that?
allergic to penicillin.
Penicillin. Good to know. Has your hearing been intact? You're able to hear, no changes in that?
No changes.
Any itchiness in the ears or discharge?
No.
And what about your mouth? Any new sores, pains, the teeth okay?
No, just regular stuff, I would say.
Okay, and how often are you going to the dentist?
Every 6 months.
Perfect, that's exactly what we recommend. Any muscle pains in the neck, any soreness like that?
I do have some shoulder pain, not right now though. From time to time, sometimes I think it's related to my job.
Your job, okay. When we get there, I just want you to point out where that's going to be, and I'll do a little bit of testing. And you said it just comes and goes, or?
Yeah.
Okay.
So it depends on how fatigued I am throughout the day.
Okay. I'll check on that. So that's in the right shoulder.
Mm-hmm.
Any difficulty with breathing, pain in the chest, tightness? No. Very good. And what about heart palpitations, any sort of fluttering or lightheadedness? No. Excellent. Stomach now, any issues with digestion or food allergies, anything that are bothering you?
No. Okay. I'm not allergic to any foods.
And regular urinary and bowel movements?
Yes.
Okay, excellent. Any pain in the hips or knees or ankles, anything in that area?
No.
And any past injuries or surgeries?
I had a C-section, 2016, and that's kind of it.
Okay. And fully recovered from that, though?
Yes.
Okay. Anything else? Any loss of sensation or tingling in the hands and feet?
No.
Wonderful. All right, so you seem pretty healthy. Let's go ahead and do a full systems check to make sure. Any other questions from me before I begin?
No.
I'm just going to sanitize my hands here. Is it okay if I touch you?
Yes.
So again, starting from the top to the bottom, I'm going to be looking through your hair. Could you take down the clip for me,
Yes,
please?
of course.
I've got a clip in today too. And I'm just going to be checking through here. Starting out, no itching or anything in the scalp,
No.
right? You do have really thick hair, so it's just going to take me just a minute to look through. Evenly distributed. Any issue with hair loss or change in thickness, any thinning in the hair?
I do have a lot of baby hair.
Like around here?
Yeah.
I do see that. But the location hasn't changed, they just are right on the line there, or do you find that they're more frequent?
I would say they were throughout the whole
way.
area, upper area of the scalp.
Do you take any sort of fish oil or do any sort of topical treatment on the hair?
No.
It honestly looks pretty evenly distributed and nice and thick. I think those baby hairs are really just just something that some people have and some people don't. There's nothing medically dangerous about it. Just gonna check the other side. I'll come behind you, okay, Matt? Any pain when I press here?
No.
About back here?
No.
It's okay. So that all looks fine to me, especially if you're not having any problems. But I am going to continue to look at the face. So just look straight ahead for me, but close your eyes. I'm going to shine a light. And just looking at the skin overall. Are you wearing an SPF daily?
Yes.
Very good. Yes, skin looks nice and healthy. There's just one little freckle there, a little bit protruded. I'm just going to measure that.
Okay.
And how long have you had that?
15, 20 years.
Okay, no changes in it.
No changes.
I'm just going to tilt your head. Okay, yeah, just about 1 millimeter, but symmetrical. No changes in color. I'm just going to make a note of it so we can watch it. Right. And just close your eyes for me once again. Just going to continue. Skin's nice and clear. Doesn't seem like you have any problem with acne or blemishes. Any pain when I press here?
No.
What about there?
No.
Okay, I'm just going to touch the tear glands. That's all okay?
Yeah.
Can you open and close your jaw for me? Close. One more time. Close. A little bit of clicking there. Is that painful at all?
Not right now, but yeah, sometimes if I eat too much,
Something
toast,
chewy
yeah,
or something?
then
It takes a lot of
straight.
mastication. Okay. And I think I noted in your, saw in your original email that you are wearing a mouth guard, right?
Yeah,
Okay. So is that helping at all?
it does.
Okay, good. Let's clench your teeth for me. Good. And one more time. Okay. That's all fine. I'm going to have you make some faces for me to test a couple of cranial nerves. So can you lift your eyebrows up nice and high and don't let me press them down. Good. Close your eyes really tight and don't let me open them. Puff your cheeks out. Don't let me close them. Good. And smile for me nice and wide. Very good. Nice and symmetrical. I'm going to have you push your jaw against my hand. Excellent. Any pain with that in the TMJ?
No.
Okay. Can you push forward against me? And back. And to the side, turn this way. Yes, very good. This way. Okay. And can you just do some range of motion for me now? Chin all the way down. I'm just going to feel the back of the neck. Any pain or discomfort there?
No.
Okay, can you go all the way back as far as you can go? Very good. And this ear to this shoulder. And then this ear to this shoulder. Can you shrug your shoulders for me? And then hold them there. Nice, very strong. No problems with resistance there? No pain when I did any of that?
No.
Didn't shoot any pain down the back?
No.
Okay. So let's go ahead and just take some basic measurements of the head and neck. Frontal cephalic. Just going to measure for symmetry really quickly, so I'm just going to be finding the midpoint here. All right, everything looks fine. No drooping or asymmetry that would be concerning. I'm going to just check for your lymph nodes. It's going to involve me palpating your neck. Again, let me know if there's any discomfort. I'm feeling for any swelling in here. Shrug your shoulders again for me one more time. So check here. I don't feel anything. Just check for the ones in the arm. Elbow there. Okay. No trouble swallowing or anything like that. Okay. I'm just going to get you a glass of water. I want to check your thyroid. So just take a little sip of that and hold it in your mouth. And don't swallow until I tell you to. Okay, now swallow for me. Very good. No enlargements detected. Moving on, I'm going to be looking at your eyes. And you've got lovely brown eyes. Any stigmatism or history of any visual disturbances or anything like that?
No.
So starting out, just looking at the eye themselves, I'm going to check for the reflex in the eye and the light reflex. So again, just stare straight over my shoulder, and it is going to be a bit bright. Apologize. Very good. Can you stare at the pen here? Can you see that? Any double vision right there?
No.
Okay, just follow it everywhere it goes. Don't move your head, just your eyes. Very good. Now follow it all the way in and all the way out. Just start your pupils. So I've got this chart here. I'm going to hold it about 14 inches from the face. Can you see that there?
Yes.
Can you read this last line for me, please?
LTFPH.
Very good. Cover one eye and read it backwards.
HBFTL.
And the same thing with the other eye, but read it forwards now.
LTFBH.
Good. I'm going to give you a card to hold in front of your eye.
Okay.
I'm going to hold a card in front of my corresponding eye. And I want you to stare straight at my nose and just tell me when you see my fingers wiggling.
No. No.
Very good.
No.
Can you switch eyes for me?
No. No.
Your peripheral's intact. test for some color blindness. Have you ever had any issues detecting colors?
No.
Can you tell me what that says right there?
12.
Okay. And what about this one?
5.
And what color is this about?
Orange.
And this?
Green.
Okay. Maybe one last test. See anything there?
7.
I'll take a look into the back of the eye now. So again, just look straight ahead. I'm going to get a little close. Perfect. Same thing here. Okay. Let's go ahead and blink a little. I know that can be a little intense. I'm going to take a look into the ears next. And just sort of look that way for me, please. Very clear, really no buildup at all, no redness. Same thing on that side. Right. So I'm going to test your hearing now with a couple of different techniques. Would you mind putting your hair back up just so that your ears are open? So the first thing I'm going to do is just make a little sound with my fingers, and I want you to close your eyes and just tell me which side you hear it on.
Left. Right. Right. Left. Both.
I want you to tell me if you hear it, and then when it goes away. Do you hear
I
it?
hear it. Went away.
Okay.
I hear it. Went away.
All right, very good. I've got a tuning fork here. I'm going to hit it and put it on the top of your head. Just tell me which side you hear it on, left, right, or equally.
Equally.
Very good. Do you hear that behind your ear?
Yes.
Okay, tell me when it goes away.
Went away.
Can you still hear that?
Yes.
Okay, tell me when that stops.
Stopped.
Do the same thing on this side again. You hear that?
Yes.
Tell me when it stops.
Stopped. I can hear it. Stopped.
All right. Very good. Bone versus air conduction. I'm going to close this ear off with my finger, and I'm going to whisper into this side, and I want you to just repeat after me, okay?
Okay.
Chili bee ASMR.
Chili bee ASMR.
Okay.
Mad bee ASMR.
Very good. So your hearing is fully intact, and you said no problems, correct?
No problems.
So let's take a look in your mouth. Just want you to say off me. Okay, very good. Can you take your tongue and press it into my finger here? And this side. Okay. And can you stick it out and move it side to side?
Oh, side to side.
Yep, no problem. Very good. Just looking for symmetry there. I'm going to put a glove on here. Take a little piece of fresh gauze. And just stick your tongue out for me. I'm just going to look underneath, on top. Very good. And that all looks fine. I'm just going to give you a couple of things to smell. So if you close your eyes for me. Deep, breathe in deeply there.
Coffee.
That's very good. I'm going to have you close one nostril and breathe in for me. Okay, good, that's clear. And now, can you smell this item?
Cinnamon.
Very good. And do the same thing, close the other side and breathe in for me. Okay, a little bit more occluded there, but let's see if you can still smell that.
I can't tell.
Okay, let me just shake it up a little bit here. It's a little bit at the bottom.
I would say barbecue spice.
It's garlic, so yeah,
Okay.
that's pretty close.
Okay.
But you were able to basically differentiate between the three scents, so that's really great. Let's take a look inside the nose now. Just tilt your head back for me, please. No deviation of the septum. Looks fine to me. Just want to look very quickly back into the mouth. Just want to check the teeth, so I'm just looking at the teeth themselves. Okay, very good. So I'm going to do a little bit of sensation testing in the face. We've basically completed all of the systems. So I've got just a little piece of cotton here. Do you feel that there?
Yes.
Okay. I want you to just close your eyes and say yes when you feel it.
Yes. 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 Yes.
Okay. Does this feel the same as that?
Yeah.
This and that?
Yes.
Same?
Yes.
And that feels fine.
Yeah.
Okay. I'm going to have a little tool here. It's got a little bit of a sharper edge. So again, I'm going to just test on your chest. You feel that versus that? Feel the difference? Here versus here.
Okay.
And just tell me if you feel sharp or dull.
Okay. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Okay. I want you to open your eyes and just look at what I have here. Basically, this is a neurotip, just very sharp tool, and I want to just make sure there's no sensation changes in the face.
Okay.
So this is quite sharp, so I'm just going to go down just the sides here, and I want you to let me know if it feels any less sharp.
Okay.
So, does that feel the same?
Yes.
Go down. Does that feel the same?
Yes.
I'm just going to do the chin here. No changes.
No changes.
Last thing is just that tuning fork again. Does this feel cold to you?
Yes.
Same.
Yes.
Okay, I'm gonna hit this. What do you feel there?
Vibration.
Okay, what about now?
No.
Okay,
Just cold.
vibration?
Just cold.
Just cold? What about here?
Yes.
Okay, so that's normal to feel it a little bit more on the bony structures of the face than the fleshy parts of the face. You have everything else correct, so I'm not really worried about any sort of sensation lost or neurological issue. Alright, so that brings us down to the body, and I'm actually going to start on the chest here, but I want to listen to your back first. So I'll have you swing your legs around, and then I'll have you lay down for the front, okay?
Okay.
Alright, Mad, so I'm going to be touching your back here, and I'm just going to start out just looking at the skin on your back. Again, even color. Nice and dry to the touch. Good temperature. Just checking there. Press down the spine. I want you to tell me if there's any pain or discomfort. Everything okay there?
Yeah.
Okay, I want you to put your head down as if you're going to dive into a pool and lean forward, and then come up really slowly, one vertebrae at a time. Nice and straight. Okay, press down the sides here. Again, any pain with that?
No.
How about here?
No.
I'm going to take a listen to the back. And I just want you to take a regular breath every time you feel my stethoscope touch you. One more time. Okay, that's clear. I'm going to be tapping, I'm just listening for the sound it makes. Can you say 99 for me?
99.
Again?
99.
One more time.
99.
Good. Take a nice deep breath in and out. Good. You take a deep breath in and let all the air out. Just blow all the air out. Okay, and hold it. Okay, take a deep breath in and hold it there. And relax. Everything sounds great. Lungs are clear. No tenderness or pain. Just going to take a look at the arms while I'm back here. Just going to do a little bit of sensory testing back here. So again, just say yes when you feel it, okay?
Yes. 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 Yes.
Okay, and the same thing, just that really sharp tool coming down the back of your arms. Let me know if there's any changes.
No.
Okay, same thing here.
No.
Okay, and does it feel the same all the way down the back?
Yes.
And how does this feel to you?
Cold. Cold.
Good. Do you feel, what do you feel there?
Vibration.
Very good. All right, Matt, so everything looks okay back there. I'm going to have you just lay back here on the pillow, and I'll take a look at the front. All right, so I want to take a look at everything, starting with this side. Just checking the skin here. I do see you have a little bit of color, a little bit of a tan. Is that recent? Just a little bit of peeling maybe?
Yes.
Okay. So you just want to be very careful not to do too much damage to the skin, but I don't see really any freckling. The skin's very clear. Let's take a look at the hands here. Just your capillary refill. Okay, I'm going to just make some motions with your hand as long as I'm here as well. Just testing the rigidity. Okay. And any pain here when I do that? Was it, you had that shoulder problem? Where was it?
It's kind of over here on the upper side of the shoulder.
Right here?
Mm-hmm.
Does it radiate anywhere?
A little bit up the neck.
Up the neck, like this?
Mhm.
Okay, so it's maybe that nerve right here coming down into the shoulder.
Yeah.
Okay. And you said you're not in any discomfort right now?
No.
Okay. So I don't see any signs of injury or bruising. I think it's probably a nerve pinching over the neck. Do you ever feel like it gets worse when you get stressed or
Definitely.
tension in the neck? Probably what happens when you get stressed or tense, you swell up a little bit, it puts that pressure on that nerve, it causes that nerve reaction down from the neck into the shoulder. So definitely breaking up some of that swelling, anything to reduce that pressure on the nerve will probably help that. While I'm on this side, I'm going to just do that sensation again. So close your eyes for me and just say yes when you feel it.
Yes. 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 Yes.
And can you flip your arm for me?
Yes. Yes. Yes.
I'm going to again poke you with a little bit of a sharper tool like that versus soft like that.
Okay.
Feel the difference?
Yes.
Just lay your hand right here like that.
Sharp. Dull. Sharp. Sharp. Sharp.
And
Dull.
flip your hand.
Sharp. Sharp. Dull.
Okay, and relax. So I'm going to come around to the other side and just check that side of the arm. So again, just starting with inspection. A couple of more freckles, but they're nice and flat. You notice any new freckles lately? Anything unusual?
No.
Okay. Move some motions here. Any pain with that?
No.
Lay your hand out like that. Just say yes when you feel it.
Okay. Yes. 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 Yes.
And flip it for me.
Yes. Yes. Yes.
Okay, tell me sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp.
Okay. How does that feel to you?
Cold.
Same over here?
Cold.
Here?
Cold.
Here?
Cold.
What do you feel right there on the knuckle?
A vibration?
How about now?
No. Nothing.
Just pressure?
Yes.
Okay.
Vibration. Vibration. Just pressure.
Perfect. Using this hand, I'm just going to poke you with either 2 points like that or
Okay.
1 point like that. You feel the
Okay.
difference?
Mhm.
So just say 2 or 1, okay?
2. 1. 2. 1. 2.
Okay, while I have this hand, I'm going to move the finger down or up. Can you tell the difference between that?
Yes.
So just say up or down.
Okay. Down. Down. Up.
Very good. Same thing on this side. I'm going to be poking you with 2 points or 1 point.
Okay. 2. 1. 1. 1. 2.
Okay? And tell me up or down.
Down. Up. Up. Down.
All right. I want you to open your eyes. I'm going to have you do some motions for me, okay? I'm going to
Okay.
test your strength in your arms. I want you to go up and down like this. Okay? Can you do that against resistance? So push me away and pull me towards you. Very good. Elbows up like this. And I want you to tell me if there's any pain with that.
Okay.
Any pain with that?
No pain.
Resist me. Okay. Just your wrists now.
Okay.
Up like that and down. Side to side. A little bit of clicking, but no problems with
No.
that. Okay. And then just keep them up and don't let me pull them down. And put them down and don't let me pull them up. Fingers apart. Keep them spread apart. Okay. Nice and tight. Don't let me open them. Very good strength. I'm going to give you something to hold, so close your eyes and tell me what you feel right here.
It's a pen.
Very good, pencil. And I'm going to draw something in your hand. I want you to tell me what I'm drawing. It's a number.
3.
Okay, one more time.
1.
Okay, can you add those together for me?
4.
Okay, same thing on the other side. I'm going to draw a letter.
D.
Okay, and one more time.
L.
Correct. So that's all intact, all the sensory as well as the neurological. I'm going to ask you a couple of neurological questions while I'm thinking about it. Can you take 100 and minus 8 for me?
92.
And one more time?
Minus 8.
Yes.
80. 84.
Okay, very good. Can I have you say a couple of words? No ifs, ands, or buts.
No ifs, ands, or buts.
Okay, and if you were to see a crying child just somewhere in the street without any parents, what would you do?
I would call the police.
Okay, so good logic, reasoning. You tell me what you had for dinner last night.
I had salmon and soup.
Okay, so good short-term memory. And what was your favorite subject in school growing up? What did you like to learn?
French.
Okay, so good long-term as well. So I will go ahead and just listen to your chest now. I'm going to grab my stethoscope. I'm going to start out with your heart. And just relax for me, please. And breathe normally. Lift this arm up for me, please. Good. No murmurs or anything. I'm just going to feel here. Any pain or fluttering when I touch you here? No. Okay. Would you take a deep breath every time you feel my stethoscope? And out. Good, very clear. I'm just going to listen to a pulse up here. No bruise. Okay, same thing, you're going to feel some tapping on the chest here. Can you say 99 for me?
99.
Just lift your arms up for me. 99.
99.
Okay. While you have your arms up, put them out for me. Keep them nice and straight and close your eyes. Can you flip them over? Don't let them move. Touch your nose with this finger. Keep your eyes closed. Try again. Touch your nose with this finger. And try again with this one. Very good. I'm going to just take a listen to your stomach now. You can relax your arms by your side. You said no pain in the stomach, no problems. Okay, I'm just going to start with just palpating here a little bit. Let me know if anything comes up. Just going to feel for the kidneys. Let's have a listen. I'm just looking for sounds of movement. I do hear them. Activities. Normal. Okay. Looking for just a pulse here in the neck. And I'm going to do just one reflex here on the stomach. And relax your arm for me. Just relax right there, okay? Give me all the weight. Just relax. There you go. Just relax. Same thing on this side. I'm going to grab this arm. I just want you to give me all your weight. Very good. I'll do your legs as long as I've got my hammer out here. So just relax your legs. We're going to move down to the lower body. Do you mind if I roll the pants up a little?
No.
Okay. That's fine. So just feeling it first, all the joints. Go ahead and relax all your weight on me. Okay. Just going to check for any clonus here. Excellent. Can you feel a scraping feeling?
Yes.
Checking the skin. Get nice and smooth and even. Say yes when you feel me touch you. Okay, what does this feel like to you?
It feels cold.
Cold, good. Same thing here?
Yes.
Cold
Yes.
and cold?
Yes.
Tell me pressure or vibration, okay?
Okay. Vibration. Vibration.
Good.
Pressure. Vibration. Vibration. And pressure.
Okay. I want you to tell me if this is the same sharp all the way down.
Yes. Yes.
Okay. Last thing I'm going to do is move that toe up and down again, just like a finger. So I just say up or down.
Okay. Up. Up. Down. 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 Up.
So, Matt, do you have any remaining discomfort after this assessment?
No.
All right. So I didn't have any findings that were concerning. We have a great baseline now to continue our patient-doctor relationship together. If anything comes up, you can always let me know.
Okay.
And that way we know that there's been a change. The only thing I would say is just to keep an eye on that shoulder discomfort. If it ever becomes unbearable, we can look into PT or maybe some sort of steroid shot to make it feel a little bit more manageable day to day.
Okay. I think for now it's okay.
Okay, good. As long as it's manageable, as long as it's not interrupting your sleep or your work and you can get through it, we definitely say just stretching, strengthening, decompressing, relaxing will help a lot.
Okay.
But as long as you're okay, then we're not too concerned about it.
Okay.
All right. Well, do you have any other questions for me today?
No.
All right. Well, thank you for coming in and looking forward to seeing you again soon.
Thank
What
you.
is going on with your hands?
Yeah, I hurt my hand the other day. Was playing basketball and it just got jammed up during
Okay.
a play.
So that was how long ago?
Couple days.
A couple days ago?
Mm-hmm.
All right, so let's go ahead and do a full, thorough hand exam. Can you tell me a little bit about what you're experiencing right now? What's the pain like?
Yeah, so the finger's been really swollen. It's a little less swollen even than it was yesterday. And just kind of painful to move, obviously. And,
Okay.
Yeah.
So some swelling, some range of motion problems.
Mm-hmm.
Is it painful if you don't touch it at all, if you leave it relaxed?
Maybe just a teeny bit, just, a little bit of pressure. It's
Okay.
uncomfortable.
Uncomfortable, discomfort. All right, so I think it is best that we just look through all the functionality of the hand, make sure there's nothing more serious, no breaks or sprains in that regard, or that there's any sort of nerve damage as well. So I'll have just lay your hands out here. So just lay right on there, please. And I'm going to have you sanitize before we begin the exam. So if you just put your hands together for me. Very good. And start with them palms down for me. Okay. And I am just going to put on some gloves, do a quick inspection to make sure there's no breakage of the skin. Did you have any bleeding, any bruising, anything like that from the incident?
No.
Okay, no breakage of the skin. So let me just quickly take a look here. And this is the affected finger, right?
Mm-hmm.
Yes, I can see how swollen it is just from here, actually. Just checking the other side. Was there anything else that was injured?
No, not that I noticed.
Okay. Flip the hands for me, please. And I don't see any open wounds or anything like that, so I will go ahead and continue the exam in my bare hands, just so I can have a better feel of temperature and any swelling that is a little bit more sensitive to feel. Alright, so again, flip your hands over for me. I'm going to just start by palpating, so feeling all of the bones, the joints, the muscles. I want you to tell me when you start feeling pain or discomfort. Any pain
Just a
on that
little-
joint?
Yeah, a little bit.
Okay.
Yeah, there's
The
pain.
discomfort.
Mm-hmm.
Okay, out of 10, 1 being no pain, 10 being excruciating, what would you rate it when I press here?
It's not very much. Probably just a 1 or a 2.
Okay, that's good. Check the other fingers. And comparatively, that feels
That feels
no pain.
fine. Yeah.
okay. And for the other side, I'm just going to check for symmetry. Just feel for temperature on this side. It's definitely a little bit more heat in this pointer versus this one. Flip your hands for me, please. Same thing, just gonna press on the hand. About right here, this joint. The other side, is that painful?
Yeah, slightly.
Okay, same as the other side, a 1 or a 2?
Mm-hmm.
Any worse sensation on this side?
No.
Okay. but that discomfort's still there.
Mm-hmm.
Everything else is okay, right?
Mm-hmm.
Just feeling for temperature on this side. And temperature is rather consistent on this side, so that's good. Okay, and relax your hands back over. I'm going to get some basic measurements here, just between the affected, to compare the affected side to the unaffected side. So starting out with the unaffected side, actually. It's about 7 centimeters, 6.5, 5.5. So we'll do the same thing on this side. That is 7.5. 8 and 6.5, 6. So we have about a 0.5 centimeter of swelling in this finger, and I can actually just see, looking at it, as I'm sure you can as well, that's swelling there. I'm going to be measuring just around the knuckles here, because that is also looking pretty swollen. So again, starting with the unaffected side, if you lift for me. 19 centimeters, and to the side, 19.5. So again, just about a 0.5 centimeter of swelling. Looking at color now, I'm just going to look for any purples or deep reds, anything that might indicate that there's some internal bruising or bleeding. And I don't see any discoloration. Was there any bruising prior? Is anything drained out of the finger so far?
I would say it was a little more purple and red.
Okay.
But maybe when the swelling was at its highest.
Right, is that its worst?
Mm-hmm.
Okay. So compared to that, right now, what would you say is 25% as swollen, 50% as swollen?
I'd say like 25%.
So it's gone down quite a bit.
Yeah.
Okay, so it's about 25% of what it once was. That's good. Let's do some range of motion for me, please. And I just want you to do the best that you can without causing extreme pain. All right, so if it starts to hurt too much, don't push yourself past point of comfort. All right, so starting out with the hands like this, I just want you to open as wide as you can go. Okay, and close as wide as firmly. Okay, can you go up with your fingers? I'm just going to hold the wrist here, up with the fingers, or the hands. Is that as far as you can go up like that? Yeah, perfect. And down. Does that cause any pain right through here?
A little bit.
A little bit of, okay. Relax the hands. I just want you to go up with your thumbs. Okay, and can you go down? And back over here. I'm just going to have you place your hands down, and I want you to lift one finger at a time. Okay, relax. And same thing, but just putting one down at a time. I definitely can see. So just with the pointer finger, if you don't mind, go down, curl this one as much as you can. Okay, and now this one. Okay, so definitely a little bit of range of motion difference there. When it gets to that point, does it start to feel pain or tightness?
Both.
Both. Okay, relax for me. I want to test your strength. Doing some of those same motions, but pushing against me. And again, if it's too much discomfort or pain, please stop me. So again, if you can just put your hands up, and are you able to push against me with this side? How much discomfort does that cause you down the finger?
A little bit.
A little bit, okay.
Mm-hmm.
Just this side then. Okay, and now just this side. Okay, definitely some strength loss. Same thing, just come back this way. Good strength. and back this way. And I can definitely feel these fingers are doing the work, and that's okay. So thumbs up for me, please. Can you keep them up against me and push them down? Very good. I'm going to just take off a piece of that, and I'm going to have you take those two fingers here and try and keep it away from me. Okay, relax. Same thing on this side. Try and keep it away from me. Good. Okay, and just relax for me. So definitely seeing a little bit of strength loss there. Nothing concerning. I think it's just that this is swollen and therefore doesn't feel that good to press. But the function is all there, just a little bit weaker than normal. Can you go this way and that way? And against my hand? Against my hand, okay. This side, side back and forth, and against my hand, against my hand. All right. So strength is fine. I'm just going to have you make some motions now with the fingers. That's going to be more checking your dexterity. All right. And again, do the best you can with that affected side. Starting with the unaffected side, touching each finger. Can't go any faster. Okay. And down, and same thing with this side. Okay, very good. I'm going to have you place both your hands down and just sort of flip them back and forth. Any tingling with this?
Not really.
Okay. Can you place your hands like this? Any tingling with that?
No.
And what about when you do this?
No.
Put your elbows up like that. Yeah, press against the wrist. Anything there?
No.
Okay, relax back down for me. I'm going to just look at the nails. Especially paying attention here. I think that's fine. The blood's returning to the nail very quickly. Maybe just a little bit slower than on this side, but not a concerning amount. Can you place each nail next to each other like that? I just want to look for clubbing. And the same thing with the other side. Very good. Thumbs are okay. You can let it down. I'm going to do a little sensation testing now in your hands. Make sure there's no sensory loss. So starting out, I'm just going to have you close your eyes. I'm going to touch you very lightly with this cotton, and I want you to say yes when you feel it.
Yes. 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 Yes.
Good.
Yes. 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 Yes.
Okay, could you flip your hands for me, please?
Yes. 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 Yes.
Good.
Yes. Yes. Yes.
Any difference between here and here?
Maybe slightly, yeah.
Slightly less sensation than here?
Yeah.
Okay. Does that feel the same as that?
Yeah, it does.
Okay. And that feels the same as that?
Mm-hmm.
Right, so we'll do a little further testing, just because there was some slight sensation loss there. So again, keep your eyes closed. You're going to feel a light puff of air. You feel that?
Mm-hmm.
And just say yes when you feel it.
Yes. 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 Yes.
Good.
Yes.
Does it feel the same there and there?
Yeah.
Okay.
Yes. 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 Yes.
Put the hands for me, please. Just going to focus right on that finger.
Yes. Yes.
Same side to side.
Yeah.
There and there.
Mm-hmm.
Here. Here.
Mm-hmm. Yes.
So I've got some cold metal here. You feel that?
Mm-hmm.
Does it feel just as cold, the same side to side?
Yeah, it does.
And here And here feels the same?
Yeah, it does.
Same?
Mm-hmm.
Okay, flip the hands for me, please.
Mm-hmm. Yes.
Okay, keep them like that. You're going to feel either this feeling here, which is just pressure, or a little bit of, what does that feel like to you?
Vibration.
Okay, so tell me if you feel pressure or vibration.
Vibration. Pressure.
Good.
Vibration. 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 Pressure.
All right, very good. Lastly, we're just going to do a very sharp tool here to make sure that that sharp sensation is intact throughout the entire hand. So you can go ahead and keep your eyes open for this, but I want you to just tell me if it feels the same sharpness all the way down.
Mm-hmm. Mm-hmm. Yes. Yes. Mm-hmm.
Good. Same thing on this side.
Mm-hmm. Yes. 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 Yes.
And this feels the same as this.
Yeah.
Okay, flip the hands for me, please. I'm just going to focus right here on this finger. Does that feel sharp all the way down?
It's a little less sharp on
Right here?
the knuckle.
And on the
area,
knuckle up
yeah.
here, like there.
Mm-hmm.
Okay, and does it feel sharp all the way on this side?
Mm-hmm.
Okay, so this feels slightly different than that.
Mm-hmm.
Okay. So I'll just make a note of that. I do think once the swelling comes down, that will, that sensation will come back. There's no major sensation loss in the hands. I think it's just, it's swollen and therefore there's a little more tenderness and a little less feeling because of all of the water swelling there. I'm going to do some reflexes in your hands. So if you don't mind just putting all your weight on me like that, and just rest on the pillow. Completely go loose for me. Very good. Same thing right here. Okay. Do you look behind me? Nope. Don't look down. Alright, I'm gonna do the same thing on everything on this side. Again, just completely relax. There we go. Nice strong reflexes. Good. Same thing, look over my shoulder, don't pay attention. Okay. And just relax down for me, please. I'm going to be poking you with either 2 points, which feels like that, or 1 point. Do you feel the difference?
Mm-hmm.
Okay. Close your eyes. Is this 2 points or 1 point?
2. 1. 2. 2.
Okay, flip the hands for me, please.
1. 1. 2. 1.
All right. I'm going to be moving this finger at the joint. Is this too painful there, like that?
No.
Okay, I'm just going to move it very slightly. Can you tell me if it's going up or down? Close the eye.
Up. Down. Down.
Okay, that's perfect. And just to do the same thing here.
Down. Up. Up.
Okay. And I definitely did feel a little bit of rigidity as I was moving the finger there myself. Just going to check every other joint here. And that's all fine. Okay. Can you, with this board, so that's your dominant hand, correct?
It is, yeah.
So I just want to get you to do a little bit of writing for me, just to see if there are any issues there. So if you could just make a circle for me, just not to be perfect. Okay, and what about a square? Okay. Any major pain with that?
Not really.
Okay. So, Jeremy, I think after my assessment here today, my full thorough assessment, I do think you jammed your finger. I think that was a correct self-diagnosis there. I do expect the swelling to take at least a week to 2 weeks to fully come down. I would avoid any major physical activity with the finger, so definitely maybe not play any more basketball for the week. You don't want to make it worse. It's already swollen. And then are you having any discomfort at night with sleeping?
Yeah, a little bit.
Okay, as that can get worse. Swelling can often get worse when we're sedentary or not moving for long periods of time. So definitely try and keep it elevated if you can. If you can sleep on top of a pillow just to give some drainage, and take a pain reliever prior to bed. Ibuprofen, something that's just going to, again, keep that swelling down. And then we can also wrap the finger, apply a little bit of pressure. So if you go ahead and put your hands back out, just this one is fine actually. I will go ahead and wrap it for you today, just so you can have that. Again, any sort of compression is helpful. You may want to look into some compression gloves if it's not getting better in a couple of days. Is that too tight on you at all?
No, it feels good.
Okay. Right, so just remove this when you shower or wash the hands. It shouldn't get wet, but you should be able to reapply it yourself or ask for help. Any other questions for me today, Jeremy?
No, I don't think so.
Okay, so I'll just make a note of all of this for the visit. If it's still bothering you in like a week, I would say definitely come back and we can do some x-rays, okay?
Okay, thank you so much.
Thank you. Hi, Heather.
Hi.
I'm Nurse B. I'm going to be taking a look at the scalp and the skin today.
Okay.
We've just been having a little bit of an outbreak of some critters here at the school, so we're asking all the teachers to come in. And there's also been a little bit of rash along with it, and so there's been some sensation loss and some tingling, and we'll just make sure everything's normal, okay? So just relax. I'm just going to look at the hair, applying some gloves first while we do the first check. Have you had any itching since the outbreak started? Not really? Okay, good. Yeah, we've had a couple of students complain of problems, so everyone needs to get a check. So I'm just going to start out looking with a light to see if there's anything obvious. Could you tilt your head down for me, please? Okay, back up. And back to me, please. Thank you. And relax. Just going to check the skin on the neck and the face. since that rash that's been going around has been reported to spread that way. And I had no itching on the face, correct?
No.
Okay, everything looks nice and clear. Close your eyes for me, please. So now that I have taken a look, there's nothing super obvious, but I'm going to run my lice comb through right here. So I'm going to be just separating the hair and checking the scalp itself, but also the hair. Just let me know if anything bothers you along the way.
There's a little tingling on that
Tingling
side
right
there.
here?
Yeah.
Okay. Do you still feel it right here?
A little?
Okay. We'll do a full sensory exam then, because one of the early symptoms of that topical rash is just a little bit of numbness and tingling.
Okay.
Let's continue with the lice. Unfortunately, kids can sometimes be full of germs, so we've got a lot of things going around here at the school. Everything feeling okay so far? No pain?
I think so.
Good. Got really thick, lovely hair, but that means a lot of places for things to hide. So we want to be extra sure. Can you tilt that head down for me, please? Thank you. Relax, release. Check the back now. So far, nothing concerning.
Okay.
Just tilt your head down for me, please. Thank you. come around to the other side to take a look at that side of the hair, okay?
Okay.
Just relax for me. I know this can be a little bit tedious, but it's better than not finding something.
Okay.
Right. So no signs of any infestation or critters. I didn't see any lice activity or eggs or anything like that, so
Okay.
that's really good. But you did just have a little bit of that sensitivity there. So go ahead and test that.
Thank you.
Heather, the first thing I'm going to do is just check for any pain before I start poking and prodding the head, okay? So I'm going to just, with my hand down, tap upon the head here, and I want you to tell me if there's any pain, either shooting, dull, aching, anything like that. I know you had that sensitivity here, but the difference is like this going to feel like this, and it's going to be more a pain I'm looking for. So let me know if anything hurts.
Okay.
Is this painful at all here, or just that sensitivity?
Just that sensitivity.
Okay, good. No pain anywhere else?
No.
Okay, good. Alright, so let's start out with just testing that sensitivity. We'll focus mostly on this right side since that's where you're having that feeling. No sensation anywhere else?
No.
Okay. So let's just start out by moving a little bit of the hair away from the section so I can focus on it.
Okay.
I'm giving you a little bit of a messy hair here, but it's for a good cause, I promise. Alright, so let's start out with our simplest, just a real light touch. So feeling like this,
Okay.
feel that?
Yes.
And just say yes when you feel it, and I'm going to sort of go all over this side of the head, okay?
Sounds good. Yes. 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 Yes.
Good.
Yes. 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 Yes.
Okay. Does this sensation, that's where you feel that little tingliness, right?
Yeah.
Does that feel any different than over here?
I mean, a little, but
You can still feel it.
Yes.
It just feels maybe a little different, or
Yes.
does it elicit that tingly response when I touch you here?
Yes.
Okay. And how about here?
No.
Okay. So next thing I want to test is your sharp and dull. So
Okay.
again, This feels soft and sharp,
Mhm.
dull to you, and this feels kind of sharp, right?
Yes.
All right, so again, close your eyes, just say sharp or dull.
Sharp. Sharp. Dull.
Good.
Sharp.
Mm-hmm.
Dull. Sharp. Dull. Sharp. Dull.
Sounds like the kids might be out for gym time,
Mm-hmm.
so finish up soon.
Sharp or dull.
Good.
Sharp. Dull. Sharp. Sharp. Dull.
And does this feel any less sharp than this over here?
I need a little.
A little? This feels a little less sharp than here,
Yeah.
and here, and here,
Mm-hmm.
here, and here.
Mm-hmm.
When does it start to feel sort of normal again? I'm going to move my way down your hair,
Right there.
right here.
Yeah.
And then again, when it stops feeling funny, when it starts to feel normal.
There.
Okay. So we have about, I think, 8 to 10 centimeters
Okay.
of slight sensation loss there. I'm going to try one more thing. It's a puff. So
Okay.
it's going to feel like that. You feel that?
Mm-hmm.
And try to really tell me when you feel air and not when you hear the sound. Okay?
Okay.
So again, tell me if you can feel that.
Yes.
Okay. Push it a little harder. You feel that?
Yes.
And does it feel the same on this side?
I mean, about.
Does it cause
yeah.
any additional tingling, or is it the
No,
same as the
it's
other
the
sensation?
same.
Okay, so just when you feel it,
Yes. 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 Yes.
okay. But again, you said that doesn't make that sensitivity worse. It's just the same.
Just the same.
All right, I'm going to take a real close look at that. I want to just make sure I'm not seeing any physical changes on the skin, since you do have a little bit of that sensation. Like I said, that 10 centimeters on your right side. I am seeing just a little bit of redness starting to come up right at the roots here of the hair. And I think that's unrelated to the lice outbreak, but could be related to that other rash that's going around. Just part of working in lots of kids, unfortunately. So I'm going to put a little bit of treatment on here preventatively. I can't say for sure if you are experiencing the rash yet, or it could be just a completely unrelated thing, but it's not a harmful treatment, doesn't cause any irritation generally, so it can only do good and maybe prevent from full-blown issue here. Is that okay with you?
Yeah.
All right, so I'm going to prepare that. I'm going to put some more gloves on, and we'll rub it into the scalp.
Thank you.
So again, I'm just going to apply the treatment with my fingers here. Mostly on this irritated side. Gonna brush out the hair. All Alright, I want to rub this in really good here, okay? Okay, let me brush out your hair.
Okay.
I think you'll be done today. Everything comfortable?
Yeah, it's okay. Thank you.
Okay. Well, I think you look in relatively good shape. There's no signs of anything really concerning. Glad we put that treatment on. If that doesn't get better, come back to the office here and we can do a full head all over the head treatment, okay?
Okay, thank you so much.
Thank you. Hi, Ivy. I'm Dr. B.
Hi, Dr. B.
Thank you for coming in today. I'm going to be performing a cognitive exam as well as a cranial nerve exam on you. This is just to test your neurological functioning and the nerves in the head and neck, okay?
Okay.
So to begin, we're going to start out with the cognitive exam. That's going to involve me asking you a lot of questions around memory, logic, and just overall understanding and thinking, okay?
Okay.
If you have any questions, don't hesitate to stop me. If anything is confusing, don't hesitate to let me know. But otherwise, I'll just go ahead and ask you a bunch of questions and answer to the best of your ability, all right?
Okay.
So first off, I just want you to tell me where we are today.
Yes, in your practice.
Okay, and about what time of day is it? Morning, evening, night?
Morning.
Okay, and what about the weather outside? Is it sunny, warm, cold, raining?
It's sunny on the warmer
Okay.
side.
So that's great that you were able to perceive all these things when you came in today and you have a sense of person, place, and time. What's your first name?
Ivy.
Okay, and what year is it?
It's 2023.
Okay, perfect. Can you tell me something notable about what's going on in the news right now? What have you been reading about lately?
So there's a lot of political news about new candidates for presidency.
Okay, so people are announcing their presidency.
Yeah.
And what year does that election take place? Do you know?
2024.
Okay. So that's very good. You have observational skills and you're also able to pull information about a future event. Can you tell me what was your favorite subject in school?
Physics.
Physics, okay. And why did you like physics?
It's very logical.
Okay. So you liked making logical decisions and you remember that very well, right?
Yeah.
Okay, good. So long-term memory is intact as well. I'm going to have you perform a series of tasks now, just checking for your cognitive function in relation to also using the extremities. So I'm going to give you something to write on here.
Okay.
And I want you to pick out the green pen
Okay.
and draw a square. Okay. I want you to pick out the yellow pen and draw a circle inside the square. Okay, and what color is this?
Pink.
Okay, take that And I want you to draw a triangle outside both of these two shapes to the best of your ability. You can overlap a little. Perfect. Very good. All right. I want you to take any of those pens that you choose, and I want you to write a sentence. It can be short, but just a full sentence from start to finish. Today is a beautiful day. Wonderful. And it is a beautiful day outside today. I'm going to just write a couple of words here. Go ahead and set that down. Okay. So I have these words, and I want you to point to the word of the thing that's alive. Very good. What about the verb that's here? Swimming, perfect. And is there a noun or object here? Okay. Is anything else here a noun?
The dog.
Okay. So that's very good for literacy and understanding. Can you read this word backwards for me? Spell that backwards.
G-O-D.
Okay. And can you spell these letters forwards? Just sound them out.
S-W-I-M-M-I-N-G.
Very good. And you can read my handwriting, which is very impressive. So I'll set this aside for now. So I've got this measuring tape here. And I'm just going to place it on the inches side for now, since their numbers are a little bigger. And I want you to point to the number 7. Okay, and what about 18? Okay, I'm going to point to two numbers, and I want you to tell me which number is larger.
20.
Okay, and what about now?
8.
Okay. I'm going to flip this over to the smaller side. If I'm here, what number is that?
30.
And you want to add 8 to it, point to where you would land. Very good. Add 5 to that, where would you land? Very good. So that was all intact. I want you to take this and roll it up into a ball.
Like burlap.
Yep, exactly. I just want to see the function in the hands, as well as the ability to follow instructions. Really looking for the coordination there. And that's fine. That's showing that you can do it. Setting that aside, I've got a few coins here.
Okay.
Now, without touching them, I just want you to point to the coin that has the most value. Correct. What about the least value? Okay. I'd like you to place them in order first from largest on this end to smallest on this end in size only.
Largest.
Largest to smallest in size only. So, in theory, we would put the penny in front of the dime. However, they're relatively equivalent in size, so that's not concerning. Now, could you switch this and put them in from the most amount of value to the least amount of value? Very good. How many cents is this?
25. 10. 5. 1.
If you add up all these coins, how much money would you have?
10, 5, 15, 16, 36, 41.
Correct. I've got a watch here. I want you to show me how you would put it on your wrist. You don't have to actually put it on, but I want to see how you would apply a watch. Very good. Okay. And setting it down. And what time does this watch currently say?
It's 1:10.
Okay. If I were to say it was 45 minutes from now, what time would it be on this watch?
1:55.
Okay. Very good. some colors here, our last little test here. And first, I just want you to pull out the blue. Okay, and set it to the side. Can you pull out the red? Okay, and one more. Which one is the green? Okay, and now I want you to place them in a rainbow arrangement where it goes from the beginning of the color spectrum to the end. Do you know what I mean by that?
What color do you put first?
You'd start with a
Yellow.
red.
Red.
Perfect. All right. So to me, everything is intact. You're able to reason, you're able to recall memory, and you're able to complete these just sort of little mental game tasks. And so that's telling me that you are able to recall quickly as well as receive information from the brain and into the hands quickly. And in addition to that, you have really good coordination and mobility in the hands. So I'm going to just set everything aside, and we'll go ahead and do the cranial nerve exam, and I'll be back with those things right now.
Okay.
Okay, upon completing of the cognitive exam, now we're going to go into the cranial nerves. So I'll just be testing all the nerves in the face and the neck and the shoulders, and we will make sure everything's intact, okay? So to start out, I'm just going to, is it okay if I touch you?
Yeah.
Okay. I'm just going to be feeling the head. Any pain in here?
No, not really.
Okay. I want to test the strength. So if you can push forward for me. And just use your head. Leave your body where it's at. There you go. And push back with your head only. And can you come to the side? Good. And this side. Okay. Can you shrug your shoulders for me? Very good. Can you tip this ear to this shoulder like that? And this way. Like that. All right. Strength is good. Go ahead and check the eyes on the face. Okay. Can you stare straight ahead for me? I'm just going to look into the eyes. It's going to be a little bit bright. Okay, I'm going to shine right in the middle here. Okay, for the reflex there. Do you see the pen here? Is it clear?
Yes.
It doesn't, no double vision or anything?
No.
Okay, can you follow it everywhere it goes and just don't move your head, just your eyes? Any double vision?
No.
Okay, look all the way at the wall, ignore this pen. Now look at the pen. Now look back to the wall and back to the pen and follow it back out. Very good. I'm going to have you cover one of your eyes.
Okay.
And I'm going to just get down to the same level here, and I want you to tell me when you see my fingers wiggling.
No. 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 No.
Okay, can you switch eyes for me, please?
No. 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 No.
Okay, very good. Going to look into the back of your eye. Just look straight ahead, trying it for me. Now we did quite a bit of reading testing in the cognition test, so no problems with reading otherwise. Any issue with distance, seeing distance?
Yeah, I do need contacts, which I'm not
Okay.
wearing.
But you do have them generally. And if you have them in, do they function properly for you? You're
Yeah.
able to see properly? All right, I've got a little piece of cotton here, and I'm just going to elicit a response here. There you go. Just looking for the blink. Very good. While I have this out, I'm going to do a little bit of sensory on your face.
Okay.
Close your eyes and say yes when you feel it.
Yes. 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 Yes.
And did that feel the same side to side?
Yes.
Same?
Yes.
A little bit less. Okay. Yeah.
There you go. I just missed it. I've got a little bit of a softer and sharper touch here. It is going to be quite sharp, so I'm not going to press it too many times, but I just want you to tell me if you can feel the difference between, feel how that's soft, and this one's a little bit sharper.
Yeah.
Okay, so just say sharp or dull.
Dull. Sharp. Dull. 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 Sharp.
Okay. Well, I've got this out. I'm going to do a reflex, so just let your jaw hang. Good. Relax your arm for me, please. Completely. Give me all your weight. Same thing on this side. Completely go loose for me. I want you to stare straight ahead. I'm just going to scrape the palms a little. I'll just continue with sensory as long as I'm there. So I'm putting this on the side here. Just tell me yes when you feel it.
Okay. Yes. 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 Yes.
Okay. What does this feel like to you?
Sharp.
Okay. Does that feel sharp there?
Yes. Sharp. 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 Sharp.
Okay. I want you to open your hand. I've got 2 points like that or 1 point like that. Do you feel the difference?
Yeah.
You say 2 or 1?
2. 1. 2.
Okay, same thing on the other side.
1. 2. 2. 2.
Okay. I'm going to draw a number in your hand. I want you to tell me what it is.
3.
Okay, same thing on this side.
7.
Yep, absolutely. Good. All right. I'm going to go back to the face now. I'm going to look into the nose. Any changes in your smell?
No.
Okay. So just tilt up for me, please. Nice and clear. No blockages. Got a couple things. I want you to close one nostril and breathe in. Good. Keep your eyes closed. Let me know what you smell.
Smells like coffee.
Yep, that's perfect. Okay, same thing here. Close the other side. Breathe in for me. Tell me what you smell.
It smells like, I don't know, spicy.
It's garlic, so yeah, that's pretty close. I'll just do one more. Just be sure to close that same nostril. And tell me what you smell here.
Cinnamon.
Yes, very good. Okay. Let's take a look into the ears. Any change in your hearing or pain in the ears?
No.
Okay. No dripping or redness. Oh, just a little puff of air is the sound.
Okay.
And I want you to close your eyes and tell me left or right.
Left. Right. Left. Right. 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 Left. Left.
Very good. You hear this sound here?
Yes.
Tell me when it goes away.
No.
Okay.
No.
Which side of do you hear it on? Left, right, or equally?
Equally.
Okay, good. Do you hear that there?
Right. Yes.
Is this, which one's louder? This, which is number 1 or number 2?
Number 1.
On this side, is number 1 louder or number 2?
Number 2.
Very good. So hearing looks great as well. Let's move on to the mouth.
Thank
If
you.
you can just open for me and say "ah." I'm just going to use a tongue depressor here to push down on the tongue. Okay, very good. Can you lift your tongue to the top of your mouth? And can you move it side to side? Good. Symmetry. Push the tongue into my hand here. Very good. And there. Very good. Any changes in your taste lately?
No.
Okay. Can you smile for me? And frown. Open your eyes really, really wide. Don't make me press down. Close your eyes really tight. Good symmetry there. Can you open your jaw for me and close? And clench here. And push against my hand. Very good. So that's all fine as well. All right, I'm going to have you put your arms out nice and straight for me and close your eyes. And can you flip your arms around? And don't move them. Keep them there, nice and level. Touch this finger to your nose, keeping your eyes closed. Very good. And now this finger. Okay, and relax. And you can open your eyes. I want you to do what I'm doing as fast as you can. Rapid movements. Okay, can you touch each finger like this? You can go a little faster than that. Very good. And relax. Okay, I'm going to have your hand here. I'm going to move the joint, and I want you to tell me, can you feel that's down and this is up?
Yes.
Okay, tell me down or up.
Okay. Down. Down. Down.
Okay, on this finger.
Up. Down. Down.
The other side, please.
Down. Up. Up. Down. Down. Up. Down.
Okay, I want you to just show me the fingers here. I'm looking for any clubbing. Can you do that? Okay. Very good. And hands like this. Any tingling or pain right here?
No.
Flip it the other way like that. Anything there?
No.
Arms up like this. Push against me. And down. Okay, up like this. Pull me towards you. Push me away. Fingers out nice and wide. Keep them open. Close them tight. Don't let me open them. Right. And I want you to push against me this way. Yep. And this side. Push this way and this way. Okay, and we did the shoulders, correct? So that all looks fine for your strength. I'll just double check here, but I think we've gone through everything. Personally, you seem to be in really good health. Your functionality of the mind and the neurological functions are all intact. Do you have any other questions for me today?
No. Do I
Okay.
need a follow-up appointment?
I think just in a year as normal, just to be sure, but unless something comes up, if there's any tingling, if there's any memory loss or change in that functionality, let us know, but you seem to be really healthy right now.
Okay. Thank you so much.
Welcome back to the office. I'm sorry to hear that you're not feeling great. I know we've seen you a few times over the last couple of years, and it seems like you have enough aches and pains that it makes sense for us to do a full palpation exam, check for any pain in any places, and record them for treatments.
Okay.
You mentioned you've been having some right shoulder pain. Is
Yeah.
that still correct?
Mhm.
Okay, let me just take some notes here. Pay particular attention to those areas. Okay, so right shoulder. And is that inside the shoulder blade or more on the surface?
Inside, kind of.
Okay, so more
yeah.
muscular. So we'll do some light palpation, but also some deeper testing as well. And what about anything else that stands out to you right now that's bothering you?
My knee has been bothering me as
The
well.
left knee, this one
Yeah.
here? Okay. And when did that start?
Just couple weeks ago.
So pretty recently. No impacts or injuries that you know of?
Not really, no.
Okay, so just started randomly. And is there any other pains that seem to be consistent or you've noticed amongst just feeling general malaise?
No, not
Okay,
really.
so just that shoulder and that knee.
Mm-hmm.
All right. So the first thing I'm going to do is just get a general temperature check. And why I do that is I'm looking for anything that's particularly cool, which may show that there's a lack of circulation to the area, or particularly warm, which could show that there's a rush of blood flow and therefore a bit of swelling or infection, anything like that. So just close your eyes. I'm going to just touch all over your face and your head here. My hands are quite cold, so I do apologize for that. Skin in the face is warm but dry. Doesn't feel excessively warm. Any issues with flushing in the ears at all?
No.
Okay. The scalp is pretty consistent. Maybe a little more warmth here in the neck. Continuing down here. I do feel a little bit of heat on that shoulder as well. Arms are equal side to side, spreading the back. I'll look a little closer at the back later when I have you lay down. Okay. Let me see your hands, please. No, hands are quite warm, which is good. That means the circulation's good. Do you have problems with cold fingers and toes in the winter?
Not especially.
Okay, that's very good. That's fine. Again, consistent side to side, nothing too cold, so that's very good. I'm just going to feel the abdomen here. And that's feeling nice and cool. And just lift your arms for me. No drastic changes there. And that's good as well. Alright, so now that I have a general sense that the temperature, there's nothing I'm super worried about on this front top body here. We'll go ahead and do the same thing on your lower body and your back when we have you switch positions. I'm going to start palpating. What that means is I'm going to start putting a little bit extra pressure on all those places I just checked for temperature. It's going to feel, I'll just do an example here, a bit more like a squeeze, okay? And I want you to tell me if you have any pain or discomfort when I squeeze.
Okay.
So again, just starting up at the head.
There is some discomfort there in my
In the
neck.
neck,
Yeah.
a little tenderness.
Mm-hmm.
Is it different side to side?
I'm a little more on the right, yeah.
Right side? Okay, that could be a part of that shoulder.
Mm-hmm.
Anything in the lower here?
Just slightly.
On the right side as well?
Yeah.
Anything up here?
Less up there.
Okay. I'm going to continue down here. Okay, the rest of the face feels okay for now?
Yeah.
Moving down here to the shoulders. Again, it's just a light pressure, so if you feel any pain or discomfort, that shouldn't be happening. There's a little bit of swelling in the hands here.
Yeah, there's slight discomfort in the hand.
Okay. And that is the right side there. Yes, thank you. Arm feels okay?
Yeah.
Okay. And what about the fingers here?
It feels okay on that side.
Okay. So definitely more pain central on the right side. Okay. Definitely feels less swollen there too. Okay. I'm just going to press the chest here. Any pain in the belly?
No.
And could you just put this to the side for me? Thank you. Okay. No other issues there, right?
No.
Excellent. So, just keeping an eye on that right side, the hand, shoulder, and neck all experienced some issues. Next thing I'm going to do is same thing, except for I'm going to just, with my hand, make sort of a tapping motion. And that's just going to be a little bit more of an impact. So if there's any nerve problems especially, that might stimulate that. I'll pay attention to the neck, that shoulder a little bit. We'll look more at the back, and the hands. But just confirm for me if there is still discomfort there, and if there's any additional discomfort anywhere, let me know.
Okay. A little bit there.
Okay, so that's still
Mm-hmm. A little bit there, yeah.
in the front clavicle?
Mhm.
Okay. Is it right there?
Mm-hmm.
Tell me, does it go away as I move towards the center of the chest?
Yeah.
Okay. What about when I come on the outside?
It's worse on the outside.
It's getting worse here, more
Mhm.
back towards that shoulder.
Mhm.
Okay, so that is probably all linked, but just keep going to be sure. Let's go back to the face here on this side. Nothing in the jaw?
No.
Good. Put your hands like that for me, thank you. Okay, that's all fine.
Mm-hmm.
Let me just do the arms here. Any nerve pain with that? Anything that shoots up?
No.
Okay. So just that tenderness.
Mm-hmm.
All right. The last thing I'm going to use is just a little bit, the hardest tool I have here. It's a bit of a reflex hammer, so it's going to feel like this. Again, I'm still going to put my hand down, but you see how that has a little more weight behind it?
Mm-hmm.
Okay, and this is just going to be the last test. If nothing else becomes additionally uncomfortable for you, then we'll move on and I'll have you lay down on the table, okay?
Okay.
So again, just keep your eyes closed and keep your teeth and your mouth relaxed, especially while I'm on the head. Is that too much?
No, it's okay.
Okay. I want to pay particular attention to this neck here.
Mm-hmm. Yeah, that.
That feel, you feel that?
Mm-hmm.
And what about neck clavicle?
Mm-hmm.
Won't linger on that. Still no pain in that jaw, right?
No.
Okay. Also listening to the sound of your chest here. Make sure there's no damage to the lungs. That's all good.
Mm-hmm.
Flip this hand over for me, please. One more time, I just want to check those knuckles. Does that make it worse?
Mm-hmm.
Okay. And flip for me, please. And that's all good. Wonderful. So we did find a few things that you didn't necessarily know were just were bothering you, which is that clavicle there and that hand. I'm glad we did the test. I'm gonna have you just scoot back here, lay with your back down. I want to take a look at the legs.
Okay.
Jeremy, before we begin, any issues with the legs besides that left knee that I should know about?
I do have some foot problems, but
One side or both sides?
more the right side.
Okay. So I'm going to first just do a little bit of temperature again. Just feeling for anything that sticks out to me. Should be able to feel any major warmth or coolness through the clothing. Feel okay. They don't feel too warm, so there's not too much active. I'll do a little bit of that testing with the palpation. And I do feel a bit of heat on this left knee. That's the one that's bothering you, right?
Mm-hmm.
Okay. I'm just going to lift this, feel the bottom. Okay. So just that increased temperature on the left knee, apologies. So again, just a bit of a squeeze here, and let me know if anything feels uncomfortable, especially in the hips here.
Yeah, a little in the hips.
Okay, is it like a sharp pain or just tenderness?
Kind of just tenderness.
Okay. Have you done any exercise recently?
Yeah.
Yeah. Okay, what was that?
That was biking.
Okay, so that could be just some tight, it definitely feels really tight, but we'll test it for sure. And then obviously a little pain here in that knee. You feel it just from me pressing?
Yeah.
Okay, and what about the other side?
The other side seems fine.
Okay. Moving down, anything in the calves?
No.
Just gonna get underneath here. Same thing on this side, just give me the weight. Nothing in the quads or the hamstrings here?
No.
Good. Same thing, quads or hamstrings? Good. Bring on down to the feet. I'm just going to squeeze all the toes. And when those foot problems, where does the pain usually occur?
In the balls of my feet usually.
Down here. How about anything with that?
No.
Oh, good. So it's not bothering you right now.
No.
Same thing again. I'll just start from here and work my way up with the my finger tapping you. If anything new comes to light, let me know. And I also want to get a number for right around here of that pain. So when I get there, I'll let you know. That's okay? Good. Any radiation up here on those hips that were sore?
A little bit.
A little bit. Does it radiate down the sides here at all? Or is it more like on the front?
It's more like on the front.
Okay, yeah, so that's probably more muscular versus that sciatica nerve. All right, moving on down here. So I want you to give me a number 1 through 10, 10 being excruciating, 1 being no pain, for what you feel around the knee.
Probably like 2 or 3.
Okay, so it's enough to be annoying, but you're not screaming in pain.
Yeah.
And same thing up here with that hip, nothing down the side, right?
No.
Okay. Next comes the reflex hammer. Again, it's going to have a little more weight behind it. It's going to be a little bit harder.
Oh yeah, right there in that ankle.
In the ankle here?
Mm-hmm.
Okay. So that was a 2, 3 in that left knee. And then what would you say the ankle is here on a scale from 1 to 10?
Maybe a 2.
Okay, so pretty minor as well, but just some, doesn't feel quite as good as the rest, right? Okay. I'll try this side. And that ankle. Any issue on that side?
No.
Okay. Definitely there seems to be an issue on the right side. You're compensating or overcompensating or something with your gait because you seem to be completely out of alignment there on that side. I'm going to go a little gentler here, but does that increase the pain at all? It does. So would you say, scale 1 to 10, does it eke up towards like 2, 3, 4 there?
Yeah, maybe 3, 4.
Okay. All right. So that 3, 4 there. Just gonna feel this side versus this side since you have that. Maybe a little bit of swelling, but nothing too dramatic. I do feel, you feel that right there, that little bit of liquid.
Yeah.
So it's just a little bit of edema in the ankle. Would you mind just putting your legs up like that for me? I just want to get the calves and underneath there with my reflex hammer. Okay. While I have you here, I'm just going to do your reflex of the legs since your legs are bothering you. So just completely relax for me. Okay. All right, not too brisk. Same thing on this side. Just relax all the weight for me. Okay. So nothing wrong with the reflexes themselves. I'm going to do the ankles here. So again, you're completely relaxed. Okay. On this side. Okay. I'm going to scrape the bottom of the foot. Good. Good. All right, Jeremy, I want to have a look at the back body now, specifically at your physical back and your chest area. So I'll have you flip around. All right, Jeremy, so let's just finally look at your back. I'm just going to feel the temperature here. You said it was that right shoulder here, right?
Mm-hmm.
Definitely a little bit of heat coming off there. How long has that been bothering you?
Just a couple weeks.
Okay. And same thing, no, you don't remember having any specific injury, right?
No.
Okay. All the other temperature feels okay. Again, starting out with that squeezing. I just want you to tell me if anything feels bad.
Yeah.
Right there, okay. On a scale from 1 to 10, what would you say this feels like?
Probably a 3 or 4.
Okay, so a little more intense than that knee. Anything, that neck was bothering you a little on the right side?
Yeah.
Okay. And what would you say that number is?
It's like a 2 or 3.
All right, again, I'm gonna hit you here. Especially want to see if anything in that spine causes anything to radiate.
Kind of right there. In the
Right up
middle.
here?
Yeah.
Okay. And that's more of a pain, like a radiation of pain, or is that just the tender soreness like your hips?
That's kind of just tender sore.
And I'm not that surprised if your shoulder's been bothering you, then your mid-back is probably going to compensate for that and try and save that shoulder since it's already hurting you.
And right there too.
Right here.
Mm-hmm.
Okay. Anything on the outside here?
Not too much.
Good. So we got a couple of spots specifically, but let's do the normal area first, the unaffected area. Still unaffected?
Yeah.
Okay. And then as I move up here, I want you to tell me when it starts to bother you.
And right there.
Right there.
Mhm.
Okay. And when does it stop? Does it keep going all the way to the neck?
Yeah, we're right about there.
Okay. So that's about 10 centimeters in the top mid-back. And
Right there.
yeah, and what number here does that increase to?
Probably a 5.
Okay, so that's pretty severe, pretty uncomfortable for you. And when does it go away?
Around there.
Okay. And nothing down here, right?
No.
And then the top shoulder, give me a number for that.
Probably a 3.
Okay, so less severe than that other one.
Mm-hmm.
Jeremy, you can sit up for me, just right on the end of the table like you were before. I'm just going to take some final notes, okay?
Okay.
All right. So I'm very glad that we went through and did that all. As long as I've got you sitting up, I'm going to do the reflexes in your arms just to complement the ones I did on your lower body. But I think other than that, we've got some good starting points to start exploring those specific issues a little bit more. And we were able to find a couple of spots you didn't even haven't mentioned in previous appointments. So we can go ahead and start investigating those as well. Hopefully getting you feeling better.
Thank you.
Just looking your arm here and full weight for me. Good. Good. Squeeze. Okay. Relax. Good. Good. Let your jaw hang for me, please. Look straight ahead. Don't pay attention to me. Okay, and then just draw this across your stomach. Okay. All right, Jeremy. Well, it seems like your service dog here is ready to go as well, so I'll let you go, but we'll get you in very soon to address some of those issues, okay?
Awesome. Thank you so much.
Thank you. Hi, Rachel. My name's Dr. B. I'm going to be performing a face skin mapping and a scalp check on you today. And let me just get your chart. So it looks like you're a new patient here. Can I just get your first name confirmed for me?
Yeah, Rachel.
Okay. And Rachel, tell me a little bit about what's going on with your skin or your scalp today. What brought you in today?
I'm experiencing a little bit of tingling in the scalp.
Tingling in the scalp, okay. And it says that you've been having issues for about 3 weeks, is that correct?
Correct.
Okay. Has it gotten worse during that time or stayed the same?
A little bit worse.
A little bit worse, okay. And is there anything that makes it worse? Showering, sun exposure, anything like that, or just
The sun.
random? Sun, okay. And anything else I should know about before I do your general exam?
No.
Okay. So because the scalp is what's bothering you, I'm going to go ahead and do that last. That way if there's any discomfort after the exam, you can just rest and recover and not have to go through the face mapping. So I'll start with the face mapping. And we do like to just do a general check and inspection of the face and the skin on the neck anytime we see a new client. So I'm going to start out just looking with a light here. And I may move you gently. Just let me know if anything bothers you. There is some freckling on the skin. Overall very moist and good shape. Checking for turgor, very supple. Couple of freckles, moles here and there, might want to measure. And how often are you getting skin checks?
Every year or so.
Okay, no problems so far. Any biopsies or anything removed?
No.
Okay. Just taking a look at the lips. Alright, so with general inspection, I do see a couple of nevi and freckles. You are fair-skinned. You mentioned the sun was bothering your scalp. Have you had any recent sun exposure or burns, or just day-to-day activity?
Stay today.
Day-to-day, okay. And are you wearing an SPF on the skin every single day?
Yes.
Perfect. So I'm going to take a slightly closer look here with my magnifying lens, and it's going to involve me touching you on the skin here like that. Is that all right?
Yes.
I'm just going to examine every section of the skin closely here. So I'm starting with the forehead here, I think. And the pores are quite small. Not much oil production in them at all. Just normal hair distribution. They're very fair. Skin is even. There is just one nevi here I want to measure. That is about only a centimeter, or millimeter rather. Round, even in texture and color. Moving on. Just another small mark here. And that one also looks fine. Just checking the eyebrows now. Even distribution. Nice thick growth. Any issues with thinning or hair loss?
No.
Okay. Do you pluck or maintain the eyebrows in any way, or is this completely natural?
All natural.
That's perfect. They look great. Looking at the eyelashes. Again, nice and thick, good distribution. I'm going to go ahead and move on to the bridge of the nose. So there's a bit more freckling here, and you do have 2 piercings I see, but I'm looking and those are well healed. How long have you had those?
About a year.
Okay, any infection or tenderness?
No.
It's all okay. So there's just that bit more freckling on the nose, a little bit more oil production as is common, and but not excessive blemishes or really no acne of any kind, so that's good. There's just a couple of freckles here as well. Just going to make a note of that and just double check, but I don't think any of them look suspicious. And we'll just mark 3 on the right side of the face, down cheek to chin. I'll just turn you here to this side. There is one down here that is just slightly bigger than normal, slightly asymmetrical. I'd say that's about 3 millimeters by 1.5 millimeters, so slight asymmetry, slightly raised as well. Any issues with that in the past? Okay. I'm just going to make a note of it. I don't think it looks concerning to me at this time. Color is uniform, but it's something we definitely want to watch. If there's any growth, we can consider removal. And now down to the lips and the chin. No cracking of the lips. Chin is very clear. There's just that one right by the nose here. But again, round, symmetrical, no darkened colors, no uneven borders. So that looks great. So you said tingling in the scalp, but no tingling in the face, correct?
Right.
So we'll just do a really quick sensation exam to make sure all of that is intact. So just keep your eyes closed and say yes when you feel me touch you.
Yes. 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 Yes.
Okay. And which one feels sharper, this one or this one?
First one.
Okay. And which one feels sharper, this one or that one?
The right one.
This one here, right?
Yeah.
Okay. And does this feel sharp or dull?
Sure.
Dull. Okay. So all of that's fine. And in general, the face is in really good shape. And I think we're going to move on to the scalp now where you're having that issue, okay? So I'll try to be as gently as possible. I'm just going to brush out the hair so I don't have any issues with tangling when I'm looking through it. Do you have any color in your hair?
Yes.
Just lift it up for me. Any breakage or brittleness after coloring?
No.
Okay. Any change in hair products over the last few weeks since you've been noticing that tingling?
No.
And how often are you shampooing the scalp?
Once every 2 or 3 days.
Okay, perfect. So not too much. And so you do have quite a bit of hair, and I do want to look through it pretty closely to make sure there's no issues. So just give me a few minutes, and I will let you know if I have any questions. I'll part it into 2 here. And we can start out on the right side. Again, I'm just going to start looking at the scalp itself. Just going to have you turn your head slightly. Is that comfortable for you? Just one little spot there I want to look at closer. Just looks like maybe an ingrown hair or something. Any pain right there?
No.
Okay, good. Am I eliciting that tingling at all when I touch you with my tool here?
Only slightly.
Okay. So I am seeing just a little bit of redness on the scalp. And a couple of spots that look like they could be sunburns. See one little freckle there I want to take a look at. measure that. Sometimes freckles can hide underneath the scalp, and we want to make sure we're tracking them. We don't forget that they could be growing. That looks fine. I'm just going to note it. Do you wear hats when you go outside? Sometimes. So because you are so fair, you may be more susceptible to burns. Of course, we're all susceptible to UV rays, no matter what. But, is that all right on your neck?
Yeah.
Just going to get this side. And come back to center for me. Just going to pull out the hair from underneath there. So I'll check the hair itself now for any deposits, flaking, critters, anything like that. But based on my initial findings, I think you're getting repeated sun exposure. That's causing some distress there on the scalp, but there's a couple more tests I need to do to confirm that. So I'm just going through the hair now with this specialty comb. It's going to grab anything that's hiding in there. The scalp is very well moisturized. There's really no flaking or dandruff, which is good. Just a fuzz. That's all fine. Didn't see anything unusual. I'm going to, before I apply a little treatment, again, just confirming my suspicions that I do think that it's a sun exposure issue. I will just go ahead and quickly test that sensation in the scalp, as well as palpate a little before I start rubbing into it. I don't want to cause too much distress, okay? So I want you to just say yes when you feel a little puff of cotton, okay? Keeping your eyes closed.
Yes. 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 Yes.
Is that too uncomfortable for you? Does that make the tingling much worse?
No.
Okay. Same thing, I want you to tell me if it feels like this sharp little scratch or a light puff, okay? So sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. dull,
Good.
sharp, sharp, sharp,
Very good.
dull.
And again, any heightened discomfort or tingling with that?
No.
How about when I press on the head here? Is this too unbearable?
No.
Okay. So that's about the max amount of force you'll feel when I apply the treatment. So should be okay there, but of course stop me if you feel very uncomfortable. Just looking at the hair itself, it's very healthy, extremely thick, no split ends, even color. I know you said you color your hair, but even here at the roots, nice even color. No thinning, just a couple little baby hairs there. Okay. So you're going to feel a little bit of a spray. I've got a little bit of a bottle, spray in a bottle that is designed to coat the skin on the scalp in the same way that sunscreen does, but it lasts a little bit longer. I do encourage you to wear hats when you can, but this will give you an extra layer of protection as well. So again, I'll start out on this right side. If you just tilt your head, perfect. I'm going to be focusing on the sides and the top of the head. It's most exposed. Obviously the bottom is important too, but it is protected by the rest of your head. Back to center for me, please. Just setting that aside. Paying particular attention to the part here that is the side that gets the most exposure to the sun. Again, just tilt your head for me. Thank you so much. So I'm just going to apply some gloves and really rub that into the scalp. Pulling the hair a little bit to stimulate that blood flow, try and get a little bit of healing to the area. I think that tingling will go away as soon as you stop getting too much exposure from the sun, because you're essentially just getting a sunburn in your sunburn. How's everything feeling, Rachel?
Good.
Okay. I'm just going to brush the hair out one more time since I have moved it up a little bit. Alright, so I'm going to just make couple of notes in the chart about what we did with you today. And we did apply that sun protecting treatment. And I'm going to send you home with a little sample of a shampoo that's specifically designed to have that effect as well. That might be good for summer. And I definitely encourage you to wear some sort of head protection as well, a scarf, a hat, that kind of thing. Any other questions for me today?
No.
Okay, any remaining discomforts?
No.
All right, well, thank you so much for coming in. I hope you feel better soon.
Thank you.
Hi, Jeremy.
Hi.
Good to see you again. I see that you've been having some trouble with your scalp, is that right?
Yeah, that's correct.
All right, well, let me get a sense of what's going on. So, you've got some tingling, you said on the phone?
Yeah, tingling in the scalp. Pretty much to the touch.
Okay, so when you feel your head, you
Yeah.
can feel kind of, it's like pins and needles kind of feeling?
Yeah,
Okay.
exactly.
And when did this start?
About a couple weeks ago.
Okay. And did it come on gradually, or did you just notice one day it was feeling tingly?
It came on suddenly.
Okay. And is there anything that makes it worse besides touching?
Yeah, after I shower.
It's
after
worse
I take
after
a
a
hot
shower.
shower.
Hot
yeah.
shower, okay. And are you using any shampoos and conditioners that are different?
No.
No change in that?
Mm-mm.
Any hats, anything you're wearing on your head that's different than normal?
Not really, no.
Okay. And have you noticed tingling anywhere else in your body?
No.
Just that. All right. Any excessive heat or coolness in the scalp?
Not that I've noticed, no.
So I definitely want to take a really thorough look. Tingling can be very harmless, but it's something we absolutely need to make sure is nothing more serious. I'm just going to start out by looking at the scalp itself. My light. Starting out, just taking a look. I'm looking for any obvious signs. Impact. Did you hit your head at all that you remember?
No.
Okay. Okay, I'm just doing a basic look. I'm going to look much deeper at some point. Any issues with the beard? The hair on the beard?
No, not that I've noticed.
Just double check that. The other side. Is this causing any of that tingling sensation as I use the tool?
Yeah, it is.
Okay, is it bearable or do you need me to stop?
No, it's very.
Okay. Again, no issues on the beard, right?
Mm-mm.
Okay. I'm going to palpate the head here. You feel it up on the top of your scalp
Mm-hmm.
and all over.
Yeah. Well, it stops on the sides.
It's not as bad on the sides.
Mm-hmm.
So this feels okay?
Mm-hmm.
Okay, tell me when you start to feel it.
There.
Right around here.
Mm-hmm.
Okay. And if I touch lightly, does it elicit the same response as if I touch more firmly?
Mm-hmm.
Okay, so it's more just the stimulation, not the amount of pressure. Okay, I want to look at the scalp there, especially along this line with a magnifying tool. And it's just going to project an image back to my screen here. Okay. Start on this side. Okay. So I am seeing a little bit of irritation on the scalp itself. A little bit of dryness. I'm not really seeing anything that I would think is cause for sensation loss or tingling in the scalp. And a little bit of dryness, a little bit of redness and irritation, but let me check the other side. pretty similar to the sides, though. If the sides are not bothering you and the top is, then I wouldn't actually think that's the issue. Okay. Just taking a look at the hair itself. Any itching of the scalp?
Yeah, a little bit.
A little bit of itching. Okay. Wonder if that's from that dryness or if it's linked. I'm gonna look through the hair itself. Just looking for any brittleness or infestation, anything that could be a sign of something else going on. Looks great. Your hair looks really healthy. Just a couple of really small flakes. It is winter, so maybe prone to dryness. Looks fine. Beard as well. Okay. Hair itself, super healthy, no splitting at the ends. Just feeling for any balding or sudden hair loss in any section, but it looks pretty thick and even. You said hot water was bothering it, right?
Yeah.
And how are you taking quite hot showers or more warm?
I wouldn't say too hot.
Not too hot. You're not getting any sort of redness or patching along the skin after a shower?
No.
Okay. I'm not seeing any hair loss or thinning spots. It's all really even. Same thing with the beard. Nice and thick, even. Texture is a little bit rougher than the hair. That's normal. I'm not sure. I'm not seeing anything super obvious that would be causing that tingling sensation. I do want to test your sensory reactions to make sure that you're feeling everything. Just because you have that tingling, you should still be able to feel the pressure in the cold versus the warm, okay? So let's do a few tests there.
Yep.
So the first thing I have here is just, I'm going to use the back of this, so it's going to feel like that, nice and light. And I want you to just signal to me when you feel me touch you, okay? So close your eyes and just signal when you feel it touch you. Okay. Good. Okay. 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 Okay, so you did have a little bit of delay on the top area, so I want to look at that closer. I just want you to tell me which one feels stronger, okay? Close your eyes and just tell me which one feels stronger, 1 or 2.
1.
One feels stronger, okay?
1. 2. 2. 1.
Okay. So when I press down on the top here, Jeremy, do you feel that tingling sensation? So you feel the pressure of my tool here, but it also has some tingling to it too.
Yeah.
Okay. I think I want to test a little bit of sharp and dull because that was a little less hard here than there. So I want to make sure you can differentiate between sharp and dull, okay?
Okay.
So I have just this little tool, and it has more of a scrapey end and then this really soft puffy end. I want to first see if you can just feel the puffy end if I place it on the scalp, on the top of the scalp. Okay, good. So it seems like when I put some pressure down, you're able to feel the soft, but if I do it really lightly, you're not able to feel that on the scalp. So now I'm going to do the sharp or dull, and just tell me if it is this scratchy sensation or the soft by saying sharp or dull. Okay.
Okay. Sharp.
Okay.
Dull. Sharp. Dull.
Okay.
Dull. Sharp. 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 Dull.
So you can differentiate, so that's good. So it does feel like a different sensation to you. This sharp feel less sharp than this sharp? Or,
Nope.
I'm sorry, let me try that again, I apologize. Does this feel as sharp as this?
No.
Okay, which one's sharper, this one or this one?
The side.
This one over here.
Mm-hmm.
Okay. Tell me when it starts to feel less sharp. So I'm going to start down here just by scraping you. That feels normal to you, right?
Yeah, it does.
Okay, tell me when it stops feeling like that.
Oh, around there.
Around there, that's when that tingling starts.
Mhm.
Okay. I'm going to do the same thing on the other side. Tell me when it starts feeling different.
Right there.
Okay. I'm just going to measure that. So right here to about right here, correct?
Mhm.
So you have about a 14 centimeter area there that's abnormal. I'm going to go from front to back. So does it feel normal on the forehead here?
Mm-hmm.
Okay, tell me when it stops feeling normal.
About there.
About there, okay. And same thing on the back here. I'm going to start down below. Does that feel normal?
Mm-hmm.
Okay, tell me when it stops feeling.
Around there.
Okay. So pretty much from the crown of the head to the back, which is about 19 centimeters. Got a little puff of air here, okay? And I just want you to tell me if that makes the sensation on this top worse. So let's say feeling right here is about a 1, comfortable, right? I want you to tell me on a scale from 1 being comfortable, no pain, discomfort, 10 being excruciating, debilitating discomfort. Tell me what you're feeling, okay?
Probably like a 3 or a 4.
Okay.
2 or 3.
Okay, so a little worse in the front.
3. 3. 3. 1.
Okay, so smack normal there. And I'm going to go side to side now. So again, starting here.
1.
Okay.
Into 3. 3. 3.
Okay.
2. 1.
Back to normal. Okay. And does that radiate anywhere, that tingling, or just feels it right on the top of your head and your scalp?
Just right on the top.
Okay. Just want to look again. Palpating it here. Just want to feel for the temperature. I'm just curious. It does feel a little bit warmer here on the top of your head than on the sides. Great. Maybe you just have a little bit of like an eczema or something that could be causing you some discomfort. It looks okay. When I pull your hair like that, does that make it much worse?
Not too much.
Okay,
no.
so maybe it's not stemming from the follicles then. Any sensation loss in the face?
No.
Okay, nothing in the beard. That's all good. Okay. Just thinking could be possibly stemming from cranial nerve, but can you shrug against me? Okay, that's strong. Can you turn your head against my hand? And this side? Okay, everything looks very symmetrical. Have you been sleeping enough lately?
Probably not.
Probably not. Okay, how many hours a night have you gotten last night?
Probably about 6.
Okay, and the night before that?
Maybe 6 or 7.
Okay, so consistently sleeping under 8 hours. How long has that been going on for?
Maybe a couple months.
Couple months. Okay, wow. So you're definitely not sleeping enough every night. You feel tired all the time.
I'm pretty tired, yeah.
Okay. And what are you sleeping on? Is it a pillow? Or do you
Pillow,
sleep right on the
pillow.
mattress?
Pillow, yeah.
Pillow, okay. And no changes in the pillow you've been using?
No.
Okay. Just making sure. My suspicion may be that it's actually stemming from being more of a headache. And that tingling could just be based on a headache, but it is curious that the hot water makes it feel worse. So we might be dealing with multiple things here. We might be dealing with a little bit of eczema and irritation of the scalp in conjunction with lack of sleep and a bit of a headache that's radiating. that any tingling when I press you here on your sinuses?
No.
Okay, what about right here?
No.
All right, Jeremy, I'm going to be completely honest that I'm not 100% sure what's going on. I'm not super worried that it's anything neurological, but I do want to give you a bit of a scalp treatment here. I'm going to just use a bit of a spray that we use for eczema and for irritation. It could also just be, do you find yourself tossing and turning a lot at night?
Yeah.
You do. So I am wondering if maybe you're just irritating the scalp and the follicles and the hair when you're tossing and turning, especially with longer hair. If you're tossing and you're pulling on that scalp, when you do that, when your hair is pulling on it at night, you may be irritating it in a way that you don't realize. So I'm going to be spraying something into your scalp, just rubbing it in. I'm hoping that that will just calm everything down because I'm not seeing a neurological reason for the issue. So you just feel something cool. Making sure it's well distributed. One more right there. And I've stopped touching your scalp. Is that discomfort gone, or is there anything lingering from the product?
Just a little bit.
Just a little, okay. So, I really want to see how this helps you. I also think you should consider wearing your hair up at night, so you're not pulling on it when you're tossing and turning, and definitely trying to get that 8 hours of sleep will be beneficial. But if it doesn't get better, please come back and we'll do some more tests. It's just good to do an initial look through, nothing major jumping out at me, but obviously that tingling's uncomfortable and you shouldn't have it. Okay. Do you have any additional questions for me?
No, I don't think so.
All right, sounds good. I'm going to go ahead and send this prescription for what I just put in your head and into your pharmacy, and you just use it twice a day, once in the morning, once in the evening, okay? Just rub it in.
Okay, sounds good.
All right, thank you, and I hope you feel better.
Thank you so much.
I'm Nurse B.
Alright.
I'm going to be doing a full systematic check of you today, since you came in to see us here at the hospital, and we just want to make sure that everything's working as it should. I'm just looking at previous notes in your chart. And it looks like you just came in with a little lightheadedness and shortness of breath. Is that correct? Okay. And how are you feeling at the moment now?
I'm feeling okay right now.
Okay, good. I know we did give you some fluids and some rest and just watched you overnight, so let's go ahead and check everything today and make sure everything's gone back to normal. Initial findings were that it could just be exhaustion, okay? So, just confirm your first name and your date of birth for me, please.
Jeremy 1-1.
Okay, great. So we're going to be starting out, moving from system to system. So let's start out first with the neurological system. Alright, so looking at my notes, it doesn't look like you had any other symptoms besides that fatigue and shortness of breath. Is that correct? A little lightheadedness?
That's correct.
Okay. Anything new that's come up since you've arrived at the hospital today?
No.
Alright, and on a scale from 1 to 10, 1 being no pain and 10 being excruciating pain, what number would you say you are today?
1.
Okay, so no pain. Do you need any medication before we begin the assessment?
No.
Okay, wonderful. So let's start out with the neurological system. Can you tell me again, just remind me who you are, what's your name?
My name is Jeremy.
Okay, and where are you today?
At the hospital.
Okay, and about what time of day is it?
It's about 11.
Okay, so oriented to person, place, and time. And do you know what you're doing here?
Yes.
Okay, so what brought you in? Just remind me why you're here in this situation.
I had shortness of breath.
Okay, so you came into the hospital.
Yeah.
Okay, so you seem like you know what's going on. Do you know what year it is?
2023.
All right, wonderful. Just testing a little bit of memory. What's the last place you traveled or visited?
California.
Okay, so that's all good. And then who was the first president of the United States?
George Washington.
Okay, all the thinking looks intact there. So, I'm going to give you this board here to test some of your cognitive abilities. And the first thing I have you do is just draw me a square. Okay, and I'm going to put some numbers on here, and I want you to just do a little bit of math. Okay, can you write out what that is? Very good. 4 plus 2 equals 6. And I'll do one more that's a little bit more complex. Good. 6 times 5 equals 30. I'm going to write a sentence here. First, can you just read that for me, please?
The boy jumped into the pool.
Okay, and I want you to circle the subject of the sentence, so very good, the boy, and then the verb, correct, jumped, and then the noun where he jumped. into the pool. All right, very good. All right, repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay, so all of that's intact as well. So far I'm not seeing any deficit in the neurological systems, but let's go ahead and continue with the cranial nerves. So first thing is just, could you make a couple of faces for me? I want to test the strength in their face. Could you raise your eyebrows up really high? Okay. And can you close them really, really tight? Okay. And puff out your cheeks for me. Good. And just for symmetry, relax and stick out your tongue. And move it side to side for me. Very good. Good symmetry there. I'm just going to take a look, and I want you to do that all again against just some resistance. Chest those facial nerves, so up against my hand. Good. And close your eyes nice and tight, and don't let me open them. Good. Puff those cheeks out. Good. And just push your tongue into my finger here and into my finger there. Okay, good strength there. I want you to open and close your jaw for me, testing the trigeminal nerve, and clench your teeth. One more time. One more time. Okay, good. All right, I'm going to test your ability to smell and taste, and we'll go ahead and we'll check the nose and the mouth a little bit later with a different system. But for right now, are you having any difficulties with smell or taste?
No.
So I want you to close your eyes, and I've got two smells here. I want you to just close one of your nostrils for me, please, and just breathe in. Okay, so that's patent and clear, so go ahead and keep that closed and tell me what this smells like. Take a big breath.
Garlic, maybe?
That's correct. Okay, now please cover the other nostril, and breathe in. And okay, relax. Now I'm going to have you take another deep breath in and tell me what that smells like.
Coffee?
Yep, that's perfect. That's excellent. Now I'm going to give you something to taste, and I just want you to taste just a little bit of it. Again, close your eyes, and just let a little bit of it hit your lips. Are you able to get that taste there?
Mm-hmm.
Okay, what does that taste to you?
Lemon?
Yep, lemon or sour. Very good. And would you like a little drink of water to wash that out of your mouth?
Sure.
There you go. Okay. I'm going to move on to your hearing now. Just checking the ears. Any pain when I touch you in the ears?
No.
Okay, look inside. Okay. All right. So the ears do look fine, just checking the outside. Same thing here. Got a glove here, okay? And do you hear that little sound?
Mm-hmm.
All right, close your eyes. Just tell me which side you hear it on.
Left. Right. Right. Left.
Okay? And make a little bit of a soft noise, and I just want you to tell me when it goes away.
It's gone.
Okay, same thing here.
gone.
Okay. I'm going to whisper something into your ear, and I just want you to repeat after me. I'm going to hold the other ear down so you can't hear it with that ear.
4, 5, 6.
Very good. Same thing on this side.
D, E, F.
All right. I just want you to tell me if you hear it left, right, or equally on both sides, okay?
Equal.
Very good. And do you hear this here behind your ear?
Mm-hmm.
Tell me when it goes away.
Gone.
Can you still hear that there?
Mm-hmm.
Tell me when that goes away.
It's gone.
Okay. I'm going to do the same thing on the other side. Again. Do you hear this?
Mm-hmm.
Tell me when it stops.
It's gone.
What about? Tell me when it goes away.
Oh, it's gone.
Okay. So hearing is fully intact. No loss of high or low frequencies. All right, and lastly for the cranial nerves, I want to check your vision. So I'm going to have you just look straight ahead for me, and I am going to shine a bright light, so I apologize, it will be bright. Okay, let your eyes get back to normal. Got just a little bit of a cotton here, and I'm going to move it into close to your eyes, and I just want you to try and ignore it and relax, react comfortably, okay? Okay, good. Good. So that reflex is intact there in the eye. Can you see my pen here?
Mm-hmm.
Any double vision with that?
No.
It looks clear?
Mm-hmm.
Okay, so just keep your head still and follow it everywhere it goes. Any double vision?
No.
Alright, that looks great. I want you to stare straight at that wall over there. Ignore my pen. And now look at the pen. Very good. And back to the wall. And back to the pen. Alright, excellent. I'm going to look just into the back of your eye now. And so just relax and look straight ahead for me. All right. I'm just going to put on some gloves now to touch your eyes. I'm going to be pulling down on the conjunctiva, so just open your eyes for me and look up. Okay, and can you do the same thing but look down for me? Okay, any pain here when I touch those tear glands?
No.
Okay, just palpating the eyes themselves. Any pain with that?
No.
Okay. All right, so the cranial nerves and cognition are intact, but I do want to do a full sensory exam. I'll start out with your face, and then I'll have you change into a gown for the rest of your body, okay?
Okay.
So first thing, I just want to know if you feel this sensation. So keep your eyes closed. I'm going to be touching you on different parts of your face, and just say yes if you feel it.
Yes. 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 Yes.
Okay, and does this feel the same as that?
Yes.
Here and here,
Yes.
here and here.
Yes.
Next, I want to test your differentiation between a sharp stimulus like that and a soft like that. Do you feel the difference between
Mm-hmm.
this and that?
Yes.
Okay, so just say sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Very good. I'm going to hit this tuning fork again. You're going to feel a little bit of a vibration. Let me show you how it's going to feel. Do you feel that vibration there?
Mm-hmm.
Okay, and I just want you to tell me if it's vibration like that or pressure just like that.
Okay.
Feel the difference? Okay.
Vibration. Pressure.
Good.
Vibration.
Mm-hmm.
Pressure. Vibration.
Very good.
Vibration. Pressure.
Very good. And what's colder, 1 or 2?
1,
1 or 2?
2.
Okay. So that's all the sensory in your face. I think everything looks fine, but I do want to go ahead and check the entire body, so I'll have you change into your gown now, okay?
Okay.
Okay, Jeremy, now that you're in your gown, we'll continue with the sensory on the upper body and the chest. And it does seem like one of our hospital therapy dogs has come in for the exam. Is that all right with you?
Mm-hmm.
All right, so we'll just move him around as needed, but people do find him very comforting. So especially if you have a little bit of white coat syndrome, a little anxiety at the doctor's, that can be very helpful.
Mm-hmm.
Right. So I'm just going to roll up the sleeves here. So I'm going to do those same sensory tests on the arms themselves. So again, close your eyes. I'm just going to touch different parts of your arm, and I want you to say yes when you feel it.
Yes. 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 Yes.
Could you just put your arms, open them like that, and lay them like that? Perfect.
Yes. 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 Yes.
Okay, very good. Any difference side to side?
No.
Same here and here,
Yes.
and here and here.
Yes.
Next up is the sharp or dull. So again, you feel the difference between this and this?
Mm-hmm.
All right, so just tell me what you feel.
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull.
And I want you to tell me if it feels sharp all the way down. Any difference in the sharpness, or is it the same?
The same.
Okay, and on this arm?
Same.
Okay. Again, vibration or pressure, so just tell me what you feel.
Vibration. 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 Pressure.
Okay. Try that again. Do you feel the difference between this? What does that feel like?
Vibration.
About now.
Pressure.
Okay.
Vibration. Pressure. Vibration. pressure, pressure,
Good.
vibration, 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 pressure.
Okay. Again, what's colder, 1 or 2? You feel 2 bits of pressure, and I want you to tell me which one is colder.
2, 1, 2,
Good.
1.
It's a bit of a trick one. They're both cold. So you feel how that feels the same?
Mm-hmm.
Okay.
1, 2.
All right. So the arm sensory is intact just for extra fun because you were feeling a little bit lightheaded and weak. I just want to make sure with this pinwheel here that feels the same all the way down. Okay, that's going to stimulate the nerves specifically, and it's going to be pretty light but pretty sharp. You can keep your eyes open and just tell me if there's any change when I come down here. Any change
No.
to the fingertips here? All sharp?
Mm-hmm.
Okay, good. And same thing on this side. Any difference coming down
No.
to the fingers? Okay. While I have this, I want you to flip your hands and just relax them down. And I'm going to be drawing a number in your hand, and I want you to tell me what number that is. Again, close your eyes.
3,
Okay. And on this side?
1,
Okay. And add those together.
4.
Very good. I'm going to have you keep your eyes closed. I'm going to place an object in your hand. I want you to tell me what that object is. Just in the one hand. Keep it in that hand.
Key.
Okay, very good. And I'm going to place something in the other hand now. And I want you to just tell me what this feels like.
A pen.
Yep, very good. Now with this hand, I'm going to move the joint up or down. So up is like this and down is like that. Just say up or down.
Up, up, down, down,
Okay, and I do the same thing on this side.
down, up, 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 down.
All right. The last thing I want to do with the neurological in your hand is just poke you here with 1 point or 2 points, okay?
1, 2, 1, 1, 2,
All right, and on this side.
1, 2, 1, 2, 2.
All right. So I just want to do a quick sensation on the legs. You were fully intact on the arms and the face, so I'm not super worried, but we'll just run that sharp pinwheel down the leg and just touch you side to side and make sure that there's nothing we've missed, okay? And no numbness or tingling in the feet, toes, feet, anything like that?
No.
And I'm just going to work around our therapy dog here. So close your eyes and tell me left or right.
Right. Both.
Good.
Left. Right. Left.
Okay. I've got this sharp tool here. Again, I'm just going to run it down the pant leg. Do you feel the sharp there through the pants?
Mm-hmm.
Okay, tell me if you feel any changes. Sharp all the way down?
Mm-hmm.
Same thing here. Sharp all the way.
Mm-hmm.
And what about the bottom of the foot?
Yep.
Okay. I'm not too concerned about testing the sensation any more in depth down there, just because we already have it pretty well mapped out on the top. But if anything changes, come back in and we can do a more thorough assessment down on the lower body, okay?
Okay.
Just making a note of that. All right, let's move on to the cardiovascular system. We'll start out with getting your blood pressure. Do you have an arm preference?
No.
Okay, let's go ahead and do this side here. Does that feel okay?
Mm-hmm.
Okay, just relax the arm there. I'm going to have you hold onto this for me, just sort of facing out with the other hand, this hand here. Yeah, perfect. Exactly. And just relax. You're going to feel a little bit of pressure, okay, Jeremy?
Mm-hmm.
Okay. That's a 110/72, so that's very good. You want to make sure it's not too low with that feeling lightheadedness. We'll check your temperature as well. So I'm just going to place this here. And we have 97.6. So it's a little bit low, but is that normal for you to run a little low?
I think so, yeah.
I'm going to listen to your heart now, Jeremy. So I'm just going to drop my stethoscope down your gown, okay? So just relax. I'm going to breathe normally. That's all fine. Just going to look at the chest wall. If you don't mind, I'm just going to move this down for just a second. That's good, you can relax. No heaving. Just going to have you put your neck back for a second. I'm just going to check a vein here in your neck. Looking for any pulsation. And that looks fine. Just going to feel here. All right. Not feeling anything out of the norm. I'm going to be feeling pulses in your neck. So first I'm going to listen to the one in the neck. Just one at a time here. Good, no girlies. Now I'm just feeling. Good. Feel the temples here. Okay. Just checking the arm pulses. Good. Wrist here. Just the top of the hands. Pulse here right in the stomach, okay? Check your ankles. There's just one here under the knee, okay? And that's all fine. So all pulses are 2+ and equal bilaterally. Move on to the respiratory system here. Cardiac system looks fine. Did you feel any fluttering in your chest when you had that lightheadedness?
Maybe a little.
Maybe a little? Okay. It seems to be okay today, but we may want to do an EKG just to make sure that there's nothing going on. And let's listen to the lungs now. So I want you to just take a little breath every time I touch you. You don't have to go too deep. I just want to be able to hear it breathing in and out. Just going to go underneath here. Alright, lung sounds are clear. I know you were having just a little bit trouble breathing the other day. Sounds like that feels better today, right?
It does, yeah.
Okay, I'm just going to palpate the chest wall. Any pain when I press on you here?
No.
What about here on the sides? Any pain there?
Maybe a little tenderness.
Just a little tenderness. Is it more in the muscle or in the ribs?
I think the ribs.
Okay. So you could have a little bit of a strain there. I'm going to just tap on each lung here, and I want you to tell me if it feels worse in anywhere than the other, okay? Feel okay?
Down on the lower feels a little worse.
A little bit more here?
Mm-hmm.
Okay. How about this side? That side's
Yeah,
okay? Same on this side? So it's really here.
Mm-hmm.
Right, I'll make a note of that. So we've got a little bit of tenderness, the oblique side of the lungs. And does it hurt to take a deep breath? I want you to take a deep breath in for me. Expand. Is that pain on that sides there at all?
No, not really.
Okay, so lung expansion is normal. I'm going to put my hands on your chest here, and I want you to say 99 when you feel me touch you, okay?
99. 99. 99. 99.
Okay, very good. That's all fine. And let's just make sure that you're fully getting enough oxygen here. I'm going to place that on your finger and just relax. It takes about 15 seconds. And 98%. So that's very normal. You should be getting full oxygen to the body. Again, no lightheadedness now. Okay. I'm going to have you just sit up for me. I'm just going to listen on the back. Okay. You're just feeling. Is that tenderness on the back here at all?
Not really.
Okay. All right, let me take a listen. And again, just take a little breath from me every time I touch you. Same thing on this side. Okay. Still sounds clear to me. I'm just going to tap on your back a little. And say 99 for me.
99, 99, 99.
While I'm back here, I'm just going to feel the spine. Any tenderness there? Okay, relax for me, please. And just open your mouth for me. I'm just going to check the back of your throat. You say ah. Okay, that's fine. And again, just breathe in and out for me. Okay. So it doesn't look like there's any sort of deviation in the septum. You're able to breathe in and out without obstruction, correct? Right. So I do want to definitely maybe just get an x-ray of those lungs to make sure. It could be a muscular thing, the oblique muscle right there along the ribs, or it could be a bit of bruising to the ribs. Have you had any impacts or anything lately?
Not that I can think of.
All right, so we'll check on that. I'm going to give you a little bit of water. Just going to check the thyroid here. I want you to take a sip of it, but keep it in your mouth. Okay, and then go ahead and swallow for me. Good. Lymphatic system's next, so let's feel the lymph nodes. Any issues with swelling in your neck or any pain, bumps that you felt?
No.
And I'm just going to feel under here. Just relax into my arm here. I'm just going to be getting up into the underarm. Okay, and same thing on the other side. Okay, relax. And that's fine. Okay. I didn't feel any sort of swelling. I'm just going to check for the pancreas. Any pain when I do this?
No.
Okay. Alright, moving on to the next system. I'm going to check all the skin on your face and arms. In fact, go ahead and just look with my magnifying light here. And I'm just going to be looking for any scrapes, bruises, moles, nevi, anything that needs attention. So just close your eyes for me and I'll just be checking the skin. And you are quite fair, so I'm just going to look relatively thoroughly. And just relax. I do just see one little slightly asymmetrical nevi here, so let me write that down. And that's on the right upper arm, shoulder. We'll just watch that. Also feeling the temperature of the skin as I do this. Everything feels warm and dry. Okay, good. Just going to check the lower legs here. And do you mind if I remove the socks? I'll definitely check the bottom of the feet and in between the toes for anything that might be hiding. That all looks great. While we're down here, I'll check your nails. Capillary refill. Okay, good. Less than 2 seconds. Put that back on for you. Is that okay?
Mm-hmm.
Check the other side now. Okay, no problems there. Cap refill is good and brisk. Alright, so the skin looks fine to me. I did check out the skin in the back when I was back there and I didn't see any issues. Just check the nails here. I want you to just check for clubbing for me. Just each finger like this. Good. And then I just want to check the capillary refill. Very brisk. Okay, that's fine. Take a look at the scalp and the head. Again, I'm going to put some gloves on for that. There's just any tenderness here on the scalp?
No.
This side?
No.
Hair is nice and thick, no thinning. Strong hairline. You notice any changes to the hair lately?
No.
Color is consistent.
Mm-hmm.
Okay, checking the beard. Same thing with the beard. Is the same texture and color as your normal used to?
Yeah.
Okay. Just gonna run the brush here through. Just looking for any infestation or anything that shouldn't be there. Just check a few spots here. Okay, that looks fine. Scalp looks healthy. And just check for, make sure there's no sun spots or moles, anything that I missed. I don't think so. Okay. So again, you said no pain or discomfort here.
No.
Okay, I'm just gonna. Alright, moving on to the skeletal system. I'm going to be doing a range of motion for the body. And that's going to just have you make a bunch of movements by yourself from head to toe, okay?
Okay.
So I want you to just put your head to forward all the way it can go and back all the way it can go. Obviously I know there's a pillow, but I'm just looking for general range. Alright, and turn to your left and to your right. Any pain with that?
No.
Can you shrug your shoulders up? Okay, and out like this. Very good. Can you go up like this? Very good. Any pain with that?
No.
Hands up and down. Good. Fingers outwards and inwards. Make a fist for me. All right, no problems there. I'm just going to have you sort of twist as best you can to your right with your back and then the other way. Any discomfort with that?
No.
Okay. I know that you have our lovely little emotional support dog on your legs, so I'll just have you put your ankles up and push down. Okay. And can you just Slide your leg out this way for me and back in. And same thing on that side, just testing that hip out and back in. Okay, so any problems sitting, standing, anything like that?
No.
Okay, can you put your arms all the way out for me and just keep them there? Close your eyes. Okay, and now the little carpal tunnel test, so like this. Any tingling in here?
No.
What about, keep them like that for me, please? What about when I tap you here?
No.
Okay, go the other way, into hands into prayer. Any pain here?
No.
Okay, relax for me. I'm going to have you do that all again, just against resistance to test the muscular strength of your body, okay?
Okay.
So I want you to push forward for me and back into my hand. Turn here and the other way. Good. Shrug your shoulders. Good. I want you to put your arms up and try and push me away and pull me towards you. Okay, wrists down. Don't let me pull you. Good. Push me away with your hands. Okay. I just want you to push me side to side. So push there and there. Good. Here and here. Very good. And you can relax your hands. Just fingers out nice and wide. Don't let me close them. Good. And put them together nice and tight. And don't let me open them. Very good. Same thing. Push out against my hand here. Good. And can you go up? Okay, nice and strong. Up. Out. Down here. And back. All right, good. Strength is all 5 out of 5. And as is movement. Let's go ahead and get your reflexes now. Checking the tendons and just give me all the weight in your arm. Just completely relax. Perfect. Okay. Same thing here. Just completely relax. Okay. I'm going to scrape the palm. Just look away. Good. I'll come around. Do the same thing on the other side. Okay. And just stare away. Good. I come down here. I'm going to slide my hand under your knee. And I just want you to fully relax on the weight of my hand. Good. I will get the ankles first. Good. Good. Same thing here. Okay. Good. Just underneath here again, just give me all your weight. Good. Just going to check the reflex in your jaw, so let it hang for me, please. Okay. Getting very close there, Jeremy. Thank you for bearing with me. Everything looks great there. I'm just going to finish up with your stomach, okay? So start out by having a listen. Put your arms to the side for me, please. There we go. And I'm just going to be listening. Okay. Hearing sounds in all quadrants. I'm going to be tapping a little bit here. I'm just listening for the resonance. Okay, and just a little bit of palpation. Let me know if there's anything that hurts. Any of that painful or tender?
No.
Go a little bit deeper. No pain or tenderness there. I have you sit up for just a second. I want to just hit the kidneys here. Any pain there?
No.
What about there?
No.
Okay, relax for me. So I think that that's all fine. check your notes here. So I've recorded everything in the computer. I'm just going to check off on your chart here that we had today's assessment. And put that right on the door. Alright, so do you have any current discomfort after this assessment? Anything that's bothering you?
No.
Alright, so I'm going to go ahead and mark you as safe for discharge today, but please don't hesitate to call back in if you're feeling any of those other symptoms. I'd also like you to schedule a separate doctor's appointment, not at the hospital, just with your regular doctor, to get an EKG test of the heart for that fluttering and an x-ray for the lungs, just to make sure there's nothing going on. But I'm going to guess that that initial diagnosis of exhaustion is probably correct. And the tension in the sides could actually be muscular, just sort of pulling on you, especially if you sit a lot, if you're looking at a computer a lot, not sleeping well. All that can play a factor, okay?
Yeah, thank you.
You're welcome. And do you have any other questions for me today?
I think that's it.
All right, so I'll go ahead and leave you with Chili, our emotional support dog, for as long as you need. And I hope you feel better very soon. Good to see you today. How are you feeling?
I'm doing okay.
Okay, so I have here on my chart that you're having a little bit of shoulder discomfort. Is that correct?
Yeah.
Did anything happen specifically?
I've just been working out at the gym,
Okay,
and so it's been sore after that.
just the one shoulder there,
Yeah,
the left
just
shoulder?
my left shoulder.
And when did that soreness start for you?
A few days ago.
A few days ago. Is it just a soreness? Is it a pain? What does it feel like? Sharp, dull?
Yeah, it's probably a dull pain.
Dull, more like an ache.
Mm-hmm.
Okay. And on a scale from 1 to 10, 1 being no pain and 10 being excruciating pain, where would you say that dull ache is?
3, 4, possibly a 5.
Okay, so sometimes it's pretty uncomfortable.
Mhm.
Okay. And have you done anything to make it better? Icing, heat,
Yeah, I've done some
ibuprofen?
icing and ibuprofen.
Okay, and is that effective at all?
Yeah, it helps.
Okay. So your main concern today is just making sure there's nothing more serious going on. So you want to continue working out, essentially, right?
Hopefully.
Yeah. Okay. So we'll make sure that there's, no signs of tearing or fractures or anything that could lead to a more serious injury if you put pressure and weight on it. And then we can do a little bit of a massage and therapy on it if it is just sore, if it is just a little bit of a tendonitis type of thing. If it is something more serious, then we will do a different treatment, okay? All right. So Jeremy, I'm just going to first, with the sweatshirt on here, just do a little bit of palpation. Any shooting pain when I press here?
No, but it's sore.
Soreness? Okay.
Mhm.
And does that elicit that soreness on that 3, 4, 5 scale? Or is it a little less?
It's a little less right now.
Okay. When was the last time you used the shoulder for any weightlifting or anything like that?
Probably like 2 days ago.
Okay. Just feeling it. Any pain into the back here?
Mm-hmm.
A little bit into that shoulder blade?
Yeah.
Okay. What about into the front here?
Mm-hmm. A
Okay.
little bit.
So it seems muscular to me. So that's this big muscle that goes across and down the front of the shoulder here. What about down the arm? Anything?
No, that's okay.
Okay. I'm just going to touch the other side for comparison. I just want to feel if there's any major swelling. No pain on this side, right?
No.
And that's all okay?
Mm-hmm.
All right. So Jeremy, I'm going to have you remove this arm out of this sweatshirt for me so I can take a look at the shoulder itself, okay?
Okay.
that all right like that?
Mm-hmm.
I'm just gonna roll this up. Sorry, my hands are a little bit cold here. Just looking for any obvious bruising, injury. You said you didn't do anything to it, right? You don't remember hitting it or popping it at all?
No, just lifting weights.
And then feeling the soreness afterwards.
Mhm.
Okay. Again, I'm just going to compare on the other side very quickly. That all looks fine. Again, just looking down the arm, looking for any bruising or drainage that might have been showing me that there was a past injury. A lot of times fluid will, the buildup will drain down the arm as the bruise heals, but no, everything looks fine there. Just gonna roll this up. And you said that it's, you know, in here, like right about here, right?
Mm-hmm.
Okay. I'm just gonna press a little bit harder now. Is that worse?
Mm-hmm.
Okay. What about on the front here?
Mm-hmm. Right there.
Okay. And is it as bad on the back?
Yeah.
It is, okay. That's that whole band right here. I'm just going to be hitting my own hand. I want you to tell me again if there's any shooting pain. And what I'm looking for is a nerve response.
Yeah.
A little bit of a nerve response right there.
Mm-hmm.
Okay.
Right there.
That's okay.
That seems okay. That kind of starts on that.
Down the back again.
Mhm.
As I get to the center here, how does that feel?
It feels fine.
Okay. Same thing down further, feels okay?
Mm-hmm.
It's really this muscle right here that comes right across the shoulder is definitely a little bit inflamed. Maybe pressing on that nerve there. Just feeling for temperature. Pretty consistently warm, maybe a little bit warmer up here. And just relax for me. The surface temperature is pretty consistent, so I'm not super worried about any infection or anything like that. Just gonna feel some pulses here. Just relax into my arm. Just want to compare side to side here. That's totally normal. So blood flow seems to be fine as well. Definitely feeling like it's a muscular nerve issue, at least at first. Can you do some movements for me? I just want to check the range of motion of the arm. And just go up with your arm like that. Does that cause you any pain?
Mm-hmm.
Okay. Go ahead and relax. Can you come up to the side? How is that?
Side's a little better.
Side's a little better, okay. And can you do the same thing but with your hand flat like that so that the shoulder's turned? How's that?
That kind of hurts.
Okay, so the most comfortable position was in with the thumb upwards, correct?
Mhm.
Okay. And then just with the shoulder like that. Any pain in the shoulder when you would do that?
Just a little bit.
Okay, I'm gonna have you rotate like that. How's that? That might be uncomfortable.
That's uncomfortable.
Okay. And then the last couple of things, are you able to put your arm back like this? Rotate the shoulder like that? Is that too uncomfortable?
Yeah.
Okay. And what about behind you like that?
Yeah, that also is
Okay.
something that-
And is that mostly on the front here or in the back?
Mostly the front.
The
yeah.
front, okay, yeah. So it's definitely this shoulder tendon right here. All right. I'm going to have you just do a little bit of strength, and I know it's uncomfortable, so I'm only going to have you make motions that I know are not super uncomfortable for you. So again, go up to the side like that, and can you just push against me here? Just come up. Okay, relax. I'm going to try the other side. Same thing, come up just with that side and push against me. Still much stronger on this side. And are you able to, again, do this one for me? And push it. Me. Okay, a little bit of weakness there on the side. Yep. All right. So that's definitely causing some lack of range of motion, some lack of strength. I'm going to test the sensory. So if you don't mind just holding that right there for me. Perfect. And I want you to close your eyes and just say yes when you feel a little bit of a fluffiness like that, okay?
Yes. 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 Yes.
Okay. And do you feel the difference between this and that?
Can you do it again?
Mm-hmm.
Yes.
Okay. Tell me if it feels like a bit of a scraping, like a sharp, like that, or soft.
Sharp. Dull. Sharp. 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 Dull. 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 Sharp.
Good. I'm going to run. Well, first of all, how does this feel temperature-wise?
Feels cold.
Feel cold there?
Mm-hmm.
And there?
Mm-hmm.
Okay. It's quite a sharp tool right here, but I want to run it down the arm and just see if there's any change in the sensation. So what I'm looking for is if it's the same sensation all the way down. Is that the same all the way down?
Sort of, yeah. Maybe a little less at the top.
A little less right here? What about right here?
Yeah, there's a little less
At the top?
sensation.
And how about in the back here?
That kind of feels the same.
Still the same?
Mhm.
All right, so it's maybe a little bit of swelling here right on the front. You can relax that hand. Because as far as, there's no sensation loss in the sense that you can feel everything. But if it's swollen, it's not going to feel quite as sharp, right? Because you've got a little bit of that water built up there, which I think is what you're experiencing. You can look right there just with a microscope here, magnifying glass rather. Just look really into the skin. What I'm specifically looking for is any burns, any abrasions, anything that could be causing the swelling from the surface as opposed to from the muscle. But I'm pretty convinced that this is a muscular strain, maybe a little bit of a tendonitis starting, especially in this front muscle because of that discomfort for some of those movements. And I didn't see anything of note. So, just taking some notes there that we did have a bit of swelling, a bit of sensory, not loss, but differentiation, weakness there, as well as strength is definitely affected, range of motion is definitely affected. Are there things that you're struggling to do with this shoulder, like how's putting on a jacket for you?
Yeah, it's uncomfortable right now.
Uncomfortable, okay. So we definitely need to address it because it's affecting your everyday living. Are you having pain when you sleep? Are you able to sleep through it?
I've been taking ibuprofen at night, so it's been manageable.
Okay. And I do suggest you continue to do that, to take that pain reliever and that swelling reliever to keep that manageable at night especially. Just make sure to do it on a full stomach or you might have some stomach issues. Just going to do your reflexes, okay? Just make sure. So go completely relaxed. I know that's probably not the most comfortable position, but just try and relax fully. Not super brisk. There we go. Just check the other side. This side shouldn't be as uncomfortable for you. We'll start here. Good. Actually, both sides, that ulnar elbow reflex here isn't particularly reactive, so perhaps it's nothing to do with your injury and simply just how you are. And then let's just take a couple of measurements, but I think I'm pretty convinced I want to do a little bit of massage and point therapy on that shoulder to help loosen up that swelling and help relax the muscle, but let's just get the measurements of the swelling so we can track it, okay? So I'll have you just lift up slightly for me, good, and relax. I'm just going to have you sort of turn the arm the other way. Yes, is that okay?
Mm-hmm.
Okay. All right, Jeremy, I'm going to have you just step out and change into a top that I can get to the shoulder and do the therapy on, and then we'll get you feeling a little bit better, okay?
Thank you.
All right, let's get started here. So again, just going to take a look. I want to focus mostly on this front part and the top of the shoulder and a little bit into the back, but it seems like the front was worse, right?
Mm-hmm.
Actually, because it's so irritated and I just want to get you relaxed for now, we just did a lot of work. I'm just going to do a little bit of a relaxation technique. Basically just a soft brush, nothing special. And just close your eyes We're just going to start to just calm down the body. Just sort of eliciting that initial nerve response here. Getting the mind's attention on this area. Starting out with just a little bit of cold scraping. Try and clear out some of that buildup, some of those toxins. Let me know if anything's too painful, okay, Jeremy?
Mhm.
Can definitely feel a little bit of crepitus here. Do you feel ready for the point therapy?
Mhm.
Starting out with our most dull pressure. It's got more surface area than all the other tools, and therefore it's going to be more distributed and less pointed. You can see how much swelling there is right here because of how much I can press into the shoulder. Spin this tool around now. You're going to feel a little bit more intensity. Moving on to our next sharper tool. Even more intense now. If it's too much, just stop me.
It's pretty uncomfortable right there.
Okay. How's that?
It's a bit
A
better.
little less?
Mhm.
Point therapy, we want to stimulate healing, but we don't want to actually cause more pain. So it's a fine line, and it definitely means that the patient needs to communicate to the practitioner. And our last tool here is going to be sharp, and it is going to be uncomfortable. I'm just going to place it in a few key places. But know that there will be some discomfort here. Okay. Okay. So as always, what you can expect is that it will take a few hours to sort of calm down, the redness to go away, and then hopefully you'll start to feel some relief. But I do suggest coming back and doing at least 2 more rounds, okay?
Mm-hmm.
There's also some exercises I can send you home with that can strengthen these back muscles here and take some of that pressure off the shoulder while you're having the strain of the muscle and the tendon. I'm just going to note our session today. All right, Jeremy, so I've noted everything we've done today, that we've done a little bit of work on that shoulder, and I would love for you to just let us know how you're feeling in about 48 hours, okay?
Okay.
All right, any questions for me?
No, not right now.
Okay, thank you so much.
Thank you.